All right, good morning, everyone. This is the Floyd County Board of Supervisors meeting for January 12th, 2021, starting at 9 o'clock. First item on the agenda is to approve the agenda.
And I'll make a motion to approve the agenda as presented.
All right, and I'll second. And item number 2 is public comment. Everybody here, I think, is here for a reason. Is there anybody on the phone that has anything that they want to bring up? Nobody's on? Okay. All right, moving along to item number 3, review/action regarding approval of the December 21st, 22nd, and 28th, 2020, and January 4th, 2021 meeting minutes.
And I've had a chance to review those and didn't find any errors, so I will make a motion to approve the December 21st, 22nd, and 28th, 2020, and the January 4th, 2021 meeting minutes.
All right, and I'll second. So motion made and seconded. All those in favor say aye.
Aye.
Aye. Motion passed. All right, next item, review/action regarding approval of claims.
And I had a chance to review those, and I will make a motion to approve the claims as presented.
Okay, and I'll second. Motion made and seconded. Further discussion on that? Hearing none, all those in favor say aye.
Aye.
Aye. Motion passed. All right, now we're on to item 5, review/action regarding the LEC courthouse project, contracts and change orders as applicable. And so we did have several that we had yesterday that we talked about.
Right.
And I had sent you the entire packet, sorry about it being late, but every one of those that I emailed you has all the supporting information. Okay.
So where would you like to start?
Lori, do you have an order?
Sure.
Go for it.
PCO 9, the hardwood ceiling.
9?
Nothing that's going to be done there, no additional savings.
That's the
No,
one
that
where we
was
got
the
a $200 credit.
That's
No,
right.
that's a
No.
$200 charge. Or credit, that
No,
was a
it
credit.
is.
We
were just
expected it to be
hoping.
more of a
We
credit.
were hoping for more.
We had a $200 credit on that, but we expected more. We
Right.
didn't get it.
Yes.
Right. So I think that one we've had out there long enough, we need to just deal with it because it is the ceiling we want in there. So I'm going to make a motion to approve PCO number 009 in reference to the ceiling in the kitchen area, I believe.
All right, I'll second that one. All right, motion made and seconded. All those in favor say aye.
Aye.
Motion passed. All right, what's the next
The
one?
next one is 42. And this is HVAC clarifications. This is the one that you would need to rescind your motion made on November 24th for PCO number 20.
Okay.
And so.
Do the rescinding
rescind
first.
and then,
Okay.
yeah.
All right, so I'll go ahead and make a motion then to rescind a motion that we made on November 24th for PCO number 20.
Okay, I'll second that.
All right, motion made and seconded. All those in favor say aye.
Aye.
Aye. Motion passed. Okay, now we're back to the PCO number 42.
And I'll make a motion to approve PCO number 042.
All right. I'll second. All those in favor say aye.
Aye.
Aye. Motion passed. Next one.
Which was up here?
PCO 043.
43, additional electrical kitchen changes.
And this one is the electrical in the kitchen area.
Isn't this one the wiring? It was additional electrical, just look at that package. So this was Paulson Electric.
This was in the kitchen area.
Yeah.
Yeah, and by the diagram, I can't tell exactly what they've changed, but obviously there was changes that
Mostly
had to be
wiring.
made.
Yeah. Well, I know that they talked about wiring for feeding to the convection oven, a steamer, a range. I think it's in there. So again, this one was in the amount, what was it? Of $1,441.26. I'll go ahead and make that motion to go ahead and approve change order number 043 in that amount.
I'll second that.
All right, motion made and seconded. All those in favor say aye.
Aye.
Aye. Motion passed. All right, the next one.
Next one is 45 for credit for the West Harvest modification.
We have 44 on our list. The Schindler elevator one, or has that already been
That
done?
one that one was approved already.
Okay.
You approved that one on December,
Okay.
you just need to sign it.
I just
Sure.
need to sign it, yeah.
That's
So I
fine.
confirmed that with Melissa this
Yep.
morning, so we got that figured out.
If you look at it, that's the change order.
Okay.
Right, and
I
so
never got to email.
this one then
But
is change order 45 for the Wix credit for the West parking modifications. This was in the amount of $2,544.
Right. Yep, and Tim explained it yesterday, it was reduction in the actual parking area
Right,
by a foot here and a foot there. So with that, I'll make a motion that we approve PCO, number back up, 045.
yeah. All right, I'll second. All those in favor say aye.
Aye.
Aye, motion passed. Okay, next one.
Okay, the next one you didn't have in your
Which one was
recent
it?
email, that's 47 for the roofing building tie-in.
Okay, that
So it was in
one.
the email from Sunday.
Okay, this is, oh, is this that tie-in that he was talking about
He
along
talked
the
about it
block
last week.
yesterday?
Yeah, and I think he talked about it last
Yes.
week too. But yes, he did bring that up, Tim did. And this one is in the amount of $1,137.75.
Right. And I can see where until they get physically putting things together, sometimes they,
They won't know.
no, and then it was a change. We changed how that was all done, so I don't know if that affected that or not, that entrance. So with that, I'll make a motion to approve 047.
All right, I'll second. All those in favor say aye.
Aye.
Aye, motion passed. Okay, next one.
Oh, that was a
48
the roof hatch.
was the roof hatch and accessories. I don't think you got one in your email from this morning.
Yeah.
Let's see, 48. So, this is the roof hatch
Yeah.
Yes.
and accessories. This included
The ladder inside.
Dean Snyder had an estimate, Midwest Roofing.
Yeah.
This was in the amount of $11,728.05.
This is probably one of those that's just frustrating that we have to do.
Yeah, I think we talked that yesterday. yesterday.
Yeah, we did talk about it
Yes,
yesterday.
we did.
But we have to have access to that roof area. It's amazing, we all realize it and agree with it. It's amazing they didn't see it ahead of time. With that, I'll make a motion to approve PCO 48.
All right, I'll second. Motion made and seconded. Further discussion? All those in favor say aye.
Aye.
Aye, all right.
This one is the salt guard, PCO 49, salt guard and salt grip.
We talked about that yesterday too.
Yeah.
So this one is in the amount of $492.
And over the life of that cement, we'll more than save that.
That's my feel too.
Yep.
And again, this is adding salt guard and salt grip to the Sally Port and the evidence storage garage.
Yep.
Okay.
I'll make a motion to approve PCO 049.
All right, and I'll second. All those in favor say aye.
Aye.
Motion passed.
I think that's an aye.
Okay. And
I think that's it, other than the, yeah. Let's see, right,
yeah, and I'm just checking on this here. Okay, the pay app. Was in our board package yesterday, correct?
yes.
Yep, okay, thanks. All right, so this one is in the amount of $482,687.52. This is for pay app number 14.
I looked through it, didn't find anything. Question, I'm just trying to pull it up.
And again, I was even checking the contingency log, this one in the back, which I think, I'm glad that that's in there. I was talking to Melissa about that. All right, any,
No, I didn't have any
questions?
questions about it.
Okay.
Like I said, I was just trying to pull it up. It's a great computer, you know how that goes. Okay.
Well, I can go ahead and make the motion to approve the pay app number 14 in the amount of $482,687.52.
And I'll second that.
All right, motion made and seconded. All those in favor say aye.
Aye.
Aye. Motion passed. Okay, so is there anything else? The only thing I would mention is I appreciate, Lori, that you sent an email out to all of the departments affected, because today they are creating those shelters around those entrances. Have they been in your office?
They've been in to take out the radiator,
The radiator?
Yep.
Okay.
but
so
they will be coming in too. They're gonna start the top.
The top, fourth, third, okay, all right. So again, we made sure that all of the departments are fully aware of what's
Good.
going on in the schedule for the rest of the month. But
It'll
think
be
as time
noisy.
gets closer, I probably run into face with a lot of the departments too, and especially it's not just yours, at the end of the month it's gonna be affected. And so we need to make sure that the treasurer's office and everybody else is fully aware of the
Right.
noise that's gonna be in here.
Mhm.
And again, I can maybe get a hold of the radio station and have something for the paper too then, so the public is aware of that. Anything else? Great. Well, we have 9:15. Why don't we go ahead and hold off on 6, since it is 9:15?
I was gonna say we are at 9:15, so you want to do 7?
Yeah, so let's go down to item 7, which will open up then the public hearing regarding Anthony and Jennifer Lacine, application to rezone 5 acres from A to R1 located at 2949 210th Street, Charles City, Southeast Southwest, 18-95-15. So the public hearing is now open. Jeff, I think you're on. I appreciate, yeah, we see.
Yes, I am.
Thank you. And we've got the chair too of planning and zoning, so would you like to give us an update then?
We had a hearing on their request to rezone from agriculture to residential, a 5-acre plot. This is out on East Clark, right beside Tony's parents' place on that property there that Byron and Pam own. And we received no negative comments. The only people that were at the hearing were the Lacines. If you have more questions, they're here right now and directly to them. But we approved that. We recommend that the Board of Supervisors also do that.
Okay. Jeff, any comments from you?
No, I only received one inquiry, and that was from Martha Kavanaugh, who lives out there too. She just wanted to know what they were doing.
Okay. So if there's nothing else,
I've received-
have you seen
For your guys' hearing, I've received no comments in support of
or against?
against, and you do have a copy of the zoning minutes.
We do.
Packet.
I read through that. That was in our packet. All right. Well, if we're not hearing anything else regarding this, I can go ahead and close the public hearing. We'll move on to our next item on the agenda then, which is item 8, which is review/action regarding resolution 05-21, zoning change for the Lacine property. And it would be the first reading schedule or waive second, third reading and/or make this a final approval. So what's your thoughts?
Yeah, I see no reason, we didn't get any comments against it, and I think that makes sense. So with that, I'll make a motion that we approve the first reading to rezone 5 acres from ag to R1 at 2949 210th Street. Legal description given here. You want me to read that? I guess 210th Street, Charles City, Southeast Southwest, 1895-15. And we waive the second and third reading, and what do we have to publish?
Approve this is final.
Approve this is fine.
Yeah, and that, or if your resolution is 0521.
0521.
Okay. All right, motion has been made then to approve the first reading, waiving the second and third reading, approving this as the final reading for resolution 05-21. Further discussion? All those in favor say aye. Aye. Motion passed. Thank you for coming.
Thank you.
Appreciate it. Thank you very much.
Good luck with the project.
Good luck. You really want to be that close to your dad?
Well, they walk together.
That's a good question. Dad or mom? Wait, that's on the record.
Maybe let's go over there and take a picture of
I'll drop mom for babysitting.
There you go.
Thanks,
Thank you
guys.
for coming.
You betcha, thank you.
Alright. Okay, so we can go back up to item 6. which is review/action regarding coronavirus COVID-19 issues as applicable. I know we talked about the changes for that some of the other counties are
Right.
doing, and that was one of the open items. And
I can just give you an idea. So far to date, we've had 1,121.56 hours of this new COVID pay.
say that again.
1,121.56 hours. I don't have that converted to a dollar amount, but that's just the hours to give you an idea.
Okay. All right.
Since March. Well, actually, that's through this previous year. It'll be the December 31st.
Yeah.
So that's.
You know,
March.
and the, you know, I appreciate that number. The hard part is sort of part of what we talked about yesterday, and that was that we do have a sick leave policy.
We do.
And a lot of those hours would have been paid through our sick leave policy. And we don't, you know, there's no way to really.
Prohibited to do that.
What's that?
You were prohibited to do that.
Were we prohibited to do that?
Prohibited to do that. The law said you have to give, you can't make them use their existing sick time.
Okay.
You have to give them this new pocket of money. That's the 1,121 hours
That was used.
But-
that was used.
But the other side of that is that if we had not, if the law hadn't been changed and we weren't forced to do it that way, there still would have been people utilizing sick time for a lot of these hours.
You wouldn't have had a quarantine situation. These hours don't reflect people who were sick.
Okay? So it's quarantine.
This is
That they were
everything.
required to quarantine.
Anything related to COVID. If they were never sick, quarantined, but weren't able to work remotely,
Mhm.
Right.
they got the COVID pay because they were in that 14-day period.
So if
So
we
they're-
don't extend it, are we saying that people can't be quarantined anymore?
Well, again.
Would our
we-
sick leave policy not allow that?
You could amend this for your sick leave policy, not expanded sick leave. You could change these sections
Yeah.
that you would allow something, like I mentioned, Lee County is doing 2/3. You could,
But then they're
Require
not
them
use their
to
sick
use-
leave for the other third.
that's what Lee County is doing.
Right.
Many of them aren't extending the date of, you've got the list. of
Yeah,
Yep,
ones
yep,
who
yep,
are
yep.
extending.
No, no, I'm
Yeah,
just,
we know.
I'm just trying to
But
figure
you
this
could allow
out.
their sick pay that's on the books to go towards this if you wanted to have the pay for them. But it wouldn't be expanded FMLA. They
So,
could use, if you want to allow their sick time,
if we hadn't had the policy in place, and I understand it was a federal law, we had to, but if none of that happened, and someone was being quarantined, what would have they used for time to do that? If they just felt they should be quarantined? And, you know, I mean, the right thing to do is to be quarantined, obviously.
okay, so outside of the law,
Yeah,
vacation,
sick time wouldn't qualify for quarantine by our current policy.
You're saying if we choose to go ahead and not extend
Right,
what we have, where are we at?
right.
Because that's really what you're asking.
That's really what I'm saying. You're right, Linda.
so, and I'm just saying, if someone, if you want, I'm just saying, it would be up to you guys if you would, take COVID out of the picture, if someone thinks they've been exposed to chickenpox.
Right.
I don't know that we've ever had that. You may allow them to take sick time out of that. It may not be FMLA, might not be it's not gonna be an FMLA likely, but if you would allow them, you could allow them to take sick time. If otherwise, if you didn't allow that for sick time, vacation time, if that's what your question was.
I think that's my question, yeah.
Right.
So then it comes back to the fact of, do we still want people to even though the federal part fell away, do we still want people to quarantine if they've been exposed?
And allow them to.
And allow them. Well,
To
we
get-
want them to, and to do that, we need to make some exception to
So you could
make sure that they will.
change this time off part for, if you want sick time or any other paid time, you could change this to allow them to use sick time or any other paid time or time off to quarantine if they're not
working.
if they're not able to work.
Yeah, and I want to state that too, you know, I mean, we still try to push.
Policy still says if
They
they
were
work remotely,
remotely,
they work remotely.
Right.
Yeah,
Right.
so I want to make sure, you know, we're
I
not
agree.
looking at the entire time that they're off, that they would have to then be using sick time.
Right, because
So it's only in those situations.
worst case scenario is you can have an employee come in and say, I was exposed, and so I won't be here for the next 14 days, and they just get 14 days off. We don't want to create that situation. Still, it's still up to the employer on if they're able to accommodate the quarantine somehow, some way, shape, or form, then we as the employer should be able to do that. Because it isn't that that employee is actually sick, it's just that we don't want them exposing other people.
I think we're probably, I don't know that you're at any point where you're ready to do anything without a draft here. So
The other thing
maybe you
too-
need to discuss it at another workshop.
That's
Yeah.
what I was gonna recommend, because we kind of talked about it yesterday, we thought, you know, even running it by Bob when we talked to him, but he literally,
He said it's not.
it's not his area of expertise, and so he didn't want to weigh in at all.
That's fine.
But I felt like, we just need to do, I think, some homework work. I would agree with that. I think let's just give us maybe some time so that we can figure something out as a draft, so that we can react to it. Like, these are options.
Yeah, I don't have the answers. I
Yeah.
see some problems here, but
Yeah,
yeah.
so, that would be my recommendation.
The only thing I just don't know now is I can't say for sure if we have anybody that's off for this. I know we do have one that's off for this right now. So right now, that person, for example, would be at 2/3 of his pay with the COVID law. That person doesn't have much sick time.
And you brought that up yesterday, I think. Yeah.
Okay.
I think it maybe warrants a little more discussion.
Okay.
Well, and if we have to, we could always make something retroactive if we do something,
Sure.
you know.
Yeah, I don't want to take too long to make this decision.
Right, I don't
Because
either.
we are in a situation where we do need to act, but I would agree.
Yeah.
Okay,
Okay.
all right. So is there anything else that we need to act on?
You know, Bob mentioned that you could talk with like ISAC or
Right.
NCC to
Yeah.
get some ideas too if you wanted. Or maybe to pull department heads together again, talk to department heads.
Okay. All right, sounds good. So we'll
Okay.
move on. There's no action being taken in regards to this line item
Mhm.
today. Okay.
No.
All right.
Is Gail here for,
Yeah.
Gail is.
is there something else down that I missed that I'm?
Well, Deb's here for,
For the, number 10. We could do that
Okay.
one.
but I know Gail's in a hurry too. She's got 10 o'clock.
I got 10:15 in the meeting, yeah.
Yep.
Okay, well, let's go ahead and move on to item 10. Review/action regarding notification to appoint the county recorder. So that was in our packet.
Yes. That was from yesterday, actually, wasn't it?
Yeah.
Right. And I thought that looked good. There was no reason to have a lapse. Of coverage for the recorder's office. Because all we would do would be create a problem. Yeah, I'm trying to pull
Because that
it
was
up
in
right now.
yesterday's.
All we would do would be create a,
Okay, so I'll just read it. Notice of
Sure.
intent to fill the vacancy of the Floyd County Recorder by appointment. Notice is hereby given that on Monday, February 1st at 9 a.m., special meeting, the Floyd County Board of Supervisors will fill the vacancy of the Floyd County Recorder by appointment pursuant to the Code of Iowa, 69.14A, inframs 2, frems A. The board will convene to the General Assembly Room located on the ground floor of the Floyd County Courthouse at 101 South Main Street in Charles City. Eligible electors of Floyd County have the right to file a petition with the county auditor requiring that the vacancy be filled by special election. The petition requires a minimum of 809 signatures of eligible electors in Floyd County and must be filed within 14 days after publication of this notice or within 14 days of the actual appointment. So this notice is published in accordance with 69.14A of the Code of Iowa, and it's by the Floyd County Board of Supervisors, and Gloria Carr is the auditor. So that is what we just need to,
and I'll make a motion that we follow through and proceed with this notice and proceed through with, as it's stated, the intent is to appoint someone on February 1st, Monday, February 1st.
all right, I'll second. All those in favor say aye.
Aye.
Aye. Motion passed. All right.
Good.
Okay. All right, so do we want to cover Gail's, since Gail has a limited time? All right, so yours is here for the...
Thanks, Deb.
Thank you.
That just means you're going for good then, right?
Okay. And you can send these to us. There you go. Yeah, that's
Thanks.
okay.
I could have
Maybe
moved.
I was
I
missing.
didn't originally know Doug wasn't going to be here.
Thanks for your email too.
Yeah, and if you think we need to pull more people in at any point.
Yeah.
I don't know what you mean.
To give the treasures. You don't want the treasures.
You can even look at it.
Okay, Gail, you're on then. Can you kind of walk us through this?
Oh, so you, okay,
So
so
we're
I brought
on-
my, I guess.
Right, your
That's what-
worksheet, yep.
And I entered what.
Oh,
We've seen those
our
before,
sheet.
too.
So that's
Okay.
what they're looking at. The only thing that's in a different order is the benefits, the FICA IFRS is on the bottom of that page where it's on, right underneath
Okay.
the wages on yours, so it looks a
Again,
little
it's
different.
Department 39.
39.
Okay.
Okay.
All right, so well, let's start with the good stuff, I guess, the revenue. I gotta look at my worksheet here, because that's what I'm trained to do, so. There's really, there's on page, I guess, one of my worksheet here, and not a whole lot of changes there, those first few things, of course, immunization services. That's VFC, so don't think COVID or anything like that, that is VFC, there's a few pandemic dollars in there. But that was focused more at influenza, not COVID. So just a slight increase there for what we received. Iowa Total Care of Mirror Group, and those are all Medicaid. So
Gail, you used 2.5% for your increase?
nope, we'll get to that.
Oh, okay, that's fine.
So that page there, that's all of them, or I should say those lines are all Medicaid. Dollars that we bring in. It's kind of a guess there. We don't know, what Medicaid HMO our patients are gonna have.
So basically, you just took those numbers and it's the same.
Right, just kind of switched them around
Switched
because
them
what we
around.
see most of our patients have, we just kind of adjust as we go. It's
Okay.
kind of a guess as to what
Okay.
we're gonna see. We don't know. We don't care if they have a Mirror Group or Iowa Total Care. It doesn't really matter.
Sounds good.
The next one, that 52,000 there, that's the Iowa Department of Public Health grant, the home care aid grant, provides services in the home, home care aid services, nursing services for those that kind of fall through the cracks, aren't eligible for Medicaid, but yet don't have their own insurance, so it kind of covers some of those people there, to keep them in their homes and not in an institution. Let's see, those AAG Health Promotion, that is some dollars that we get from Elderbridge to do the same thing for those people that fall through the cracks. And then there's some, they have to be 65, 60 or 65 for Elderbridge, I can't remember, but there's some age parameters there that they do have to meet. Bioterrorism, there, that number is a little bit low because the previous year we did not receive a whole lot of dollars. We split that grant with several other counties in the region. Saragordo holds that contract. We sign with them. You kind of project to see what maybe you're going to do going forward with bioterrorism. So this really, again, not much to do with COVID. Preparing for an event. Typically work with the EMA a lot on these sorts of things.
Right, that's what I was gonna say, that's very close connected.
So, we did build some gloves, supplies, things like that to that grant this year. Also trying to get approved to build some, like jackets or nursing scrubs, things like that, for my nurses for when we are doing mass vaccination clinics, something to identify them, and something that's been kind of needed throughout this response. Next page, as we move down here, school contracts, we do go to Rockford School, we'll continue to do that. We serve as their nurse. They have a health associate, but we go in and write their plans and things like that for them. We've done that for several years. We'll continue to do that as they need us. Private pay, people that, are paying for our services privately on a sliding fee scale. Are those two line items there. Donations, we do get some random donations occasionally. The other one, Wellmark, of course, private insurance. Immunization school audits, that's something that we do, which have to be done by March 5th this year. We go to every school, do their immunization audits. And then Connect America is just a life alert that we get reimbursed for if we put that in one of our patients' homes. So.
Okay.
The miscellaneous there, that's kind of a large item, but that is all VA, private insurance, Charles City Community Fund, things like that get thrown in there. So that revenue there totals, so you can see it there, 692,900. So
Okay.
not much off from the previous year.
Not much off, yeah, pretty close.
Expenditures. Let's see if there's anything here that's really, you had asked about employees and if I went with what, 2% or 2.5%, whatever it was that was given to me. My answer is no, I did not. I did 5%, reason being, my nurses, if you want to, there was talk of hazard pay. My nurses and my home care aides and my staff have endured a lot from this past year. They're taking calls that are not very nice calls, not just one or two a day, several a day, and those calls continue. My staff has been out in the trenches the entire time, going into patients' homes, caring for them regardless if they had COVID or not. We're in the home, they're wearing PPE, they're wearing masks, they're wearing face shields every day. It's not like we quit services because of this. We didn't. We continue to go. My nurses continue to go. My nurses are going to be putting in long hours here too with vaccination clinics. So on top of their other duties, they're already now expected to give vaccine. I do as much as I can and try to take some of that burden off, but it's getting to the point where I do need extra help. And my nurses also and my staff need to be compensated for everything that they have done throughout this pandemic. It has not been easy. I can tell you that. It is a 24/7 job. So,
Do you happen to know, and this is just information, I'm asking, is like across the industry locally with the nursing homes and hospital, have they done increases for their staff? What are they doing?
What I do know about the nursing home, because I talk to Sue quite often, is they do reimburse them if they have a COVID positive wing and they have staff that's working on the wing.
Specifically.
Yeah, then they do get a higher reimbursement.
Okay. Yeah.
As far as the hospital, I'm not sure what they're looking to do or have done for their staff. I don't know, I don't get involved
Sure,
in any of
sure.
that.
I just
I
asked if
happened to
maybe
have
you
that
knew that.
conversation
Yeah, I
with Sue.
Yeah.
And the only thing that goes through my mind too is that when we're talking about COVID, you know, and again, it's the unknown. Is it going to be short-lived, continue on? For us to give an increase, it's not like it's compensating them for the additional work that they're doing now, but then eventually it goes back to maybe a standard, you know, I don't know what normal. And that, I don't think there is a normal anymore, but I just had to throw that out, you know, so when we look at giving increases in pay, that's there.
Mhm.
And it's not like
Yep.
it's for a time period
Mhm.
where you've gone through some.
And I get that, but
Really
public health
difficult
is not going away. This is not going away. COVID will be here forever. We don't know going forward if it's gonna be a shot every year. Does public health have to give that shot every year, or is that gonna be delegated to pharmacies, clinics? We don't know.
Right.
But either
And-
way, COVID is here for good, along with flu, along with everything else.
So
But
it doesn't, yeah.
that hazard will be here forever. So that my staff will be dealing with that forever going forward.
That's why I had
those
to ask, you know,
environments, yeah.
because I just want to make sure that we're looking at this the
Yeah.
right
And
way.
if you want to get even deeper in it, I mean, everybody thinks COVID's going to go away. The only virus that we've ever come close to eradicating is smallpox. So we still have measles, we still have mumps. COVID's going to be the same. It's here, so.
Right.
um,
I was just curious, my first question, you know, and I appreciate everything everybody does. I was just trying to figure out what the industry's doing, because you've got the problem of trying to hire people and keep people working.
Yes.
And if
That's my
they
other
see
issue.
where they can get a better situation someplace else, whether it's financial or work situation or whatever, you're gonna lose them. I realize that.
So, and that's another thing that I did
So-
look at too. I need to keep my staff.
Yeah.
Right now, I do not have time to train another
Mhm.
staff person, period. And the question, I mean, I need another person, and my board did approve to hire another nurse, which I need to do because I need help with public health programs, but when it comes to just taking that time to lose one of my nurses that are fully trained would be very, very difficult right now.
Okay.
Okay.
So you did the 5% across the board, including your wage?
Yes,
Okay.
yeah, yeah.
Okay, I just want to make sure I understand.
And yeah, I'd invite you to come sit in my office a day.
No.
Answer the phones for us if you want to kind of see what a day in the life of a public health staff member is right now. It's
Been
not
in your
fun.
office enough.
Okay.
I know, but those are just the questions we just want to make sure that we're clear on.
And
so
I
what your
do, and you
expectations
question
are.
my wage too, Roy, and I do want you to know that I've picked up a lot of extra duties, not just public health duties. I've been helping with some of the EMA duties.
Yes, you have,
Mm-hmm.
yeah.
Okay.
And I appreciate it, more than you know.
Okay.
So that's my wage discussion. Does that
Right.
answer all your?
That's good.
Okay.
What else on here then?
I'm just trying to think. Otherwise there is no big, the therapies, those have increased a little bit.
Yeah.
We do get reimbursed by Medicare for them, but the reason being is we're seeing these people come home that were COVID positive. Whether they're coming home from the hospital, they're coming home from the nursing home, they're coming home weak, very weak, and lots of therapy needed. Just because they're coming home doesn't mean they're good to go. They're not, they still need services. So we're seeing a lot of OT-PT in the home.
So is that services that your outreach people do, or do you actually pay therapy
We
for
have
that?
subcontracts with
It's a contract service, okay.
Yeah,
Okay,
Yeah, that's increased quite a bit.
yeah.
yeah.
We're seeing a ginormous jump in that.
Okay.
Vaccines went down.
Yeah, so that's flu.
I'm,
And so
okay.
the reason for that is we did a lot of open clinics, a lot of walk-in clinics. We went to a lot of places. We went to foster grandparents. We went to the bank. We went to all these places, which we didn't do this year. Foster grandparents didn't come to us. We couldn't have those open clinics. The bank ended up going to Hy-Vee, which is perfectly fine. We don't care as long as people are getting the vaccine.
Right.
But we'll adjust, and that's why we made that adjustment
Okay.
there. We won't order as much that 65 and older flu. We're seeing it, people go to the convenient places to get it, like
And
the
that makes
Hy-Vees.
sense.
So they've gotten the
Great sense.
vaccine just in other ways.
Yeah, there's still, yeah,
Yes.
isn't a reflection
Yes.
that
Yep.
there's a lessened
We'll still
number of people
promote it,
getting
we'll
it.
still, yeah.
Okay,
And we continue to give the flu vaccine to our VFC children, and this year we could give it to adults that qualified also. So anytime we had one come in, we were offering it. So,
Okay, all right, sounds good.
Otherwise, I don't see any other.
Everything else looks about the same.
Yeah.
The COVID-19 vaccines are gonna be all federally
Yes,
funded
you got it, yep.
as far as the dollars for the material itself.
Uh-huh. And there is the option there, it's agency's choice, if they want to bill Medicare and Medicaid, we are able to do that for the administration fee. We're going to do it. We're going to try to capture all those Medicare and Medicaid numbers that we
Good.
can and give it our best shot to try to get some of those dollars coming back for our
Right.
county too.
So that-
A lot of agencies are not, but I think we're
Okay,
gonna give it a shot. And then again, there's another task on my staff.
Absolutely.
sure,
Um,
okay.
So, lots of unknowns. We, this last $14,000 we received, as it was spent, in a couple months with just my time primarily. We don't know if we're getting more dollars coming through. We don't know how much overtime my staff is gonna be spending giving vaccines. So, COVID has created a lot of unknowns, so it was really hard to do this, to budget, to share.
You know, I thought about this too, Gail, and that's something I know we can talk about. So when we go out to the fairgrounds, our discussion with Amy was, paying for, the use of the utilities and the building and everything else. I'm just trying to think of where that comes from. I know Dusty, you had mentioned, that if it's being given and there'd happen to be a snowstorm or something and we've got a scheduled day that you would help with that. But I'm just trying to think of, the fairgrounds is being very good about, offering up their building, but, we still want to be able to pay for those, the service of being able to have that building open and the utility. I'm just trying to think where that money, where it best, is it EMA?
Well, it's either gotta be
Is
emergency
it-
management or public health.
Right,
I think.
and it's one of those, and I was gonna talk to you about that too. I'm trying to wrap my head around, just making sure that we don't lose sight of that.
My thoughts are, it could go in, her budget is a larger budget, that could absorb it until you could amend,
Yeah,
Yeah.
okay.
if you have many expenses or anything.
And who knows, we may get some funding coming through that, I can build that too, my funding sources.
Okay.
I don't know.
That's just something you and I just need to
Yeah.
figure out.
And I can't even comprehend how big this gets. Like, do you have extra help lined up to do this? And then are they volunteer, are they paid?
That's a good question too. We've had this discussion a little
Well,
bit too.
so what we're planning right now is, again, I told you, I've been working with Tom Bach, both of us have, because of the CERT team. So
Right.
he's overseeing that. So we're looking at the CERT volunteers manning the computers
Sure,
upstairs
they
in
can
the
do something, right?
EOC. So they're volunteering their time to go ahead and as calls come in to schedule appointments, they're actually creating the schedule.
Okay,
But then you're gonna have additional staff that's gonna have to be at those doors on those days that, we're doing it.
Yeah, so it'll be most of my staff. I probably just leave one office staff in the office for that day. I've had quite a few people from the public call in volunteering their services or saying they would help, not saying they would volunteer, maybe as, paid to assist.
Sure.
Which,
Right.
in my mind, you almost have to pay someone to do what they're gonna be doing. I've also had, I've reached out to the hospital and talked to them a little bit about utilizing some staff. Talked to Sue Ayers a little bit about utilizing staff, so,
Which she even offered.
yeah.
yeah, I was gonna say, you probably got a lot of retired professionals out there
Yeah.
that kept their credentials up. They
You
could-
have to be very, very careful because I want to make sure they're vaccinated before
Yep,
they help. So there's that whole hurdle to get through too, and I know the hospital staff and nursing home staff
Sure.
would all be vaccinated, if they choose to be.
And again, we don't know how long it's gonna take until everybody is vaccinated.
Well, that's why I
And so
said I
that was
can't
her
even-
point about this isn't going away, so.
I can't even really
We're still in
comprehend
that
that.
initial round. We haven't even gotten to the general,
No.
Yeah.
population.
So and what you also have to remember is people think that we're gonna get like just a ton of vaccine and we'll be able to do, so they open it up to 1B, say they open it up to everyone 75 and older. We may only get 500 doses, we may only get 200 doses. I don't know, and so then we're gonna have to come together as our group that has been meeting and prioritize, okay, we have 200 doses. How are we gonna break this down into who's gonna receive it? So there's gonna be a lot of difficult
It's
questions coming up.
Very tough.
How does it work? Like, we have an employee who's, was diabetic 1, and they treat at the diabetic center in Mason City. They're a Floyd County resident. And they got a call from that center and said, we're scheduling shots, and he's got an appointment for like 3 weeks out. So it doesn't go by county how they're distributed out, or?
He shouldn't be receiving a shot if that's his only reason for getting it.
That's what he told me.
Yeah, that's very interesting.
And they
That
called
should not
him.
be happening.
Yeah, they called
But-
him. He didn't
But
call.
either way, unless it's VA is completely different. They get their own, they're getting their vaccine completely different than local public health and everything. So, doesn't matter if you live or work in Floyd County, we're giving them the vaccine. We don't question because.
So like Cambrex, if we went out and they all, were okay to go ahead and get all their employees, they may live in another county, but they work in Cambrex.
Same as the hospital, so they're giving it regardless of where they live. I've had a lot of people, who work for the Red Cross, whatnot, they call, they live in Floyd County, I have them scheduled this Friday, we're doing another clinic, so a lot of people coming in Friday that I call. I've reached out the best I can, it's out there, I want people to call me too, if they think they qualify, great, call, we'll walk through it. So, it's a challenge.
It is.
And we feel like
mind-boggling
hundreds of
just to-
calls every day of, especially our older residents,
Oh, yeah.
wanting the vaccine. And it's hard to tell them no.
Anybody I talk to that's over 70 automatically goes, when do I get mine?
Well, and then
It's like,
other states are doing it.
Yes.
So that's
Yeah.
what's a challenge too, is that other states are.
Yeah.
And so how come you're telling me I can't, so.
And so what we do have planned is great for right now, when administration change is way above us, and they release, and what they're saying is they're gonna release all this vaccine. It's gonna create another nightmare for us, because we know now that when we give our first dose, I've already accepted my boost dose. I've already accepted my second dose from the state for that person. So I can, the day they get their shot, I'm giving them an appointment for their second shot. They know when to come, I'll send a reminder email, reminder phone call to them to come in. If it's all released at one time, we're gonna have a real challenge in how we are going to contact those people again, and how those people are gonna know what day we're giving them their boost dose.
Right. We didn't want to get into having to be a call center where we're accepting, like, can't make it today, I can maybe make it next week. So now all of a sudden, our CERT teams just become schedulers and trying to deal with calls. So it is a challenge because we have to look at, that's a possibility, and then how do we handle it? Because they can't make that date that we've already told them is their second shot.
And eventually, I do believe the state is gonna open it up. They have a pharmacy partnership. And it's at the state's discretion when they wanna open that up. So to let the pharmacies, like your Hy-Vees, I know Main Street Drug here too is interested in doing it. I've talked to her also. Eventually, when the state gives the go-ahead, these places can give vaccine, but they've told us that that's not gonna be in the near future. I think they really wanna get through at least 1A, 1B. Before that's even thought about, so.
I see the legislators are gonna try to move things through faster in the state.
I heard that yesterday, that that's one of their top
So,
priorities.
I agree and I disagree with that. I understand why they're doing what they're doing right now, because your larger counties, it is a huge challenge. Like even Cerro Gordo, that have these large hospitals, these large healthcare centers, it's a challenge for them to get enough vaccine to vaccinate their healthcare providers. Where for us, we could do it just like that. We know it's in our county, we work well, just that we don't have a large number. So we're ready to move on. We're ready to move on to 1B. But the bigger counties aren't. So what we would see happening then is all these people from the larger counties would be coming to us, would be coming to the smaller counties trying to get vaccine.
More vaccine.
And then it would just inundate us and we would be having the same issue. So I get what they're doing.
All right, I know we strayed a little bit from the budget.
Yeah, no,
no,
And so
we'll do
anyway,
budget.
thanks for the
Thanks for the
information.
information, and we'll
Mine
work
was
through the
mostly
budget,
tied to,
obviously.
I'm making sure that we're accounting for
Yeah.
those dollars that,
Yes.
you know, just because of the vaccine rollout, we want to make sure that we're not forgetting about some possible expenses.
So, but, and then we go back to my expenses too, if you look at my expenses, not much off from last year. Last fiscal year, So,
Sorry.
very close.
Okay.
I think tax asking last year was, the current fiscal year is 375, and this going forward 391, so.
And then you had your meeting with your board last night, correct?
Yep, and they did approve.
Okay,
So,
all right.
Okay.
Any questions of Gail?
No,
The
I
only
don't
thing,
think so.
You got it.
the only thing I'll mention is that they approved the budget. In the budget included the 5%, but just they still need to take more action on those wages at some point before July.
yeah, this would go into effect from July 1.
Right. But they would approve the employees getting that. This, approving the budget doesn't approve the wages.
Correct.
Yeah,
Oh, yeah,
right.
yeah. I wasn't
Right.
gonna start this like next week or
Yeah,
anything
yeah.
without approval or anything.
No, I just meant your board need to.
Okay,
Yeah.
all right, thank you so much for coming,
Yep.
appreciate it.
Thank you.
All right, so next, I know we've got John here.
Yeah, John.
John, good morning.
Morning.
All right, so we have you
Morning,
down.
John.
Morning.
Good to see you
Number
sneak
12.
in.
Well, we've got John for a budget.
We got budget, but we also
We
have down
also-
on item 12.
Yep.
So why don't we talk, so you're on our agenda. So item 12 on our agenda is discussion regarding communications dispatch, transition / note hiring of employees. So you want to give us an update on all your employees?
Well, we got them all the paperwork all filled out.
Okay,
Learning the new pair, I was just up with Sandy for
Really?
last time, we got all
good,
figured out.
good.
I think we got everything pretty good in place. We're starting to plan to move, that was Bernie yesterday, got some of that stuff that he was looking for.
Good,
You know, just kind of starting planning on the move
yeah.
now.
So again, just what I had challenged Bernie and John with, just to make note of that, was putting a plan together of what it's going to take to physically make that move. So that's including computer systems, you know,
Right.
connectivity between where you're at today and here, what comes, maybe what doesn't, and maybe that's part of it too. Between what's over there that might be sitting, I don't know, you guys just need to let us know, you know, what falls into those categories, but do you have a date you're shooting for by any chance? And I didn't throw that out with you and Bernie as far as,
Yeah, well, with the state, I gotta give them a 90-day
right,
for the NCIC stuff.
before anything physically comes
Be-
over?
Yeah, because, yeah, they need a date. I was thinking, we're had nothing in plan, but we were thinking right around the May area. You know, I can give the state a notice, but they need a date, and I just don't know the complete, where we're looking at about.
Is that date adjustable at all? You've got to give them at least 90 days. What
At least
happens if
90
you give them
days.
90 days out and you get 30 days away from that and say, I want to extend that another 15 days?
I would think we probably could, because they gotta have their people come up and actually
Sure.
do that
Sure.
stuff. I'd have to check with
Yeah.
them at field service. I would think so, because I can't imagine that, you know, like when Winnebago moved, you know, they had to give their notice and, you know, I'm sure they had some hiccups somewhere.
Sure, yeah.
Okay,
As long as they have something down there, I imagine that we'd say, hey, it's gonna be 2 weeks later. But
Right.
we'd probably know that, probably at least a month ahead of time, so if they gotta reschedule their people.
okay. All right, sounds good, great. Well, we're very happy that you were able to build your team,
Yes.
you know, with experienced dispatchers. So that's good to hear.
Yep.
All right. Anything else that you want to share with us before we go through the budget?
You can also, the next one has to do with communications, just so John knows what's happening with it.
Okay.
Oh, the reserve fund.
Yeah.
All right, so item
Item
13 is review/action regarding resolution 07-21, establish new fund, communications reserve fund and department. All right,
So this one, we've created a new fund number, 17,000. And this would be, as it says in the resolution, to receive that money that's built up from the county's $14,000 that's sitting at the city, with the city being the fiscal agent. They'll cut us a check for that money.
okay.
And then, I guess, so once that's done, I'm gonna get more into the budget talk. I've got in here that it's also if the board would decide to continue to feed money to that fund, that this covers that type of transaction as well.
This resolution.
Yeah,
Okay.
yeah. And so that's when we get to budget time, then we'll talk about what do you want to fund to that, if you want to fund to that
Sure.
as well.
All right.
Sure, there's pros and cons to doing that, obviously.
Yeah.
Yeah. Yep.
Well, I'll go ahead and make a motion to approve resolution 07-21.
And I'll second that.
All right, motion made and seconded. All those in favor say aye.
Aye.
Aye. Motion passed. Okay, so now we can go ahead and cover your budget. Do you want to do that, or?
Yeah, well, and
Or
have you got information there?
Well, I got my last year, the stuff that I gave to the chief, I went and asked him, he printed this out for me because we were going to do a thing. And well, he gave it and he apparently did not save it, and that was this morning when I came back and noticed that we didn't have the thing. I can easily get through all our line items except the wages
Okay.
and stuff. There's, you know, we go by line item per line item, because have you finished building? Oh,
Up to
yeah,
you.
yeah, that's fine.
So
I get around.
No, I hadn't gotten.
Okay.
I'm working on it.
All right, yeah, so if you just kind of want to walk us through it, that's fine.
We still have the same line items, right, Gloria?
Yeah,
That we
so
had before.
John and I did go through, we did go through and did comparables to what the city's line item codes are, to what our codes are, and what the phone or supplies or that kind of thing. So I got the code built, the city plug numbers in, and then,
Okay.
and we actually will use today for the amendment, but we have to approve it by Friday, so we know we're going to go on as well. So, yeah, we're,
So do we have sheets on that at all yet?
do that, I did do that.
That's fine.
Oh, that's
I'm
what
just,
we were
that's what I was looking
gonna
at.
do after the
Okay.
meeting.
Okay,
Am I missing something?
so if you just
That's
kind of
all right.
want to walk
Go
us through
ahead,
it,
I'll
then we'll
listen.
listen.
Well, as far as what we do know, there are a couple of line items, like the life insurance, from the salary, the overtime, the FICA, the IFRS, and the health insurance, and dental insurance, and the workman's comp. I imagine it's probably a different number.
Yeah, but we don't have
Probably
we have never, anybody that's in, we don't end up billing the departments for the work comp, unemployment, other than if they're in a different fund, that's
Okay, but if you're on general fund, then we don't.
But since we're out of general fund, so there won't be a line item for that.
Okay?
Probably one of the biggest changes when we were in our talks was the uniform allowance.
Yeah,
We went to 150 per dispatch,
right.
Right.
so that would drop down.
$9,000. Or $900.
$900. We kept the dues on the dispatch, that's kind of the APCO-MENA memberships that I
Okay.
belong to.
Okay.
When we go to training,
All right.
we're just keeping that the same.
All right,
Notaries, I prefer to stay that the same, but we're spread out enough, it's $30 per dispatcher, but we're spread out to where that's been covering that,
okay,
so we just kept that the same. Travels and meetings is 2,000. Which a lot of it, we just started some online training stuff, so we're gonna have to cost, so I didn't change any of that. We haven't used a lot of that at all this year because of the COVID.
You can't do that.
Yeah, we
No,
can do
that's
that.
sorry,
The
Bernie.
class is there, and so it's maybe,
You think it's okay?
I don't want any issues.
I think if you see anybody,
Okay,
maybe.
right.
Bernie's out there. Make sure if anybody's there that you let them come in, okay?
Yep, I will.
Because we're an open meeting, so.
I was just closing a little bit because they're
Okay.
hauling stuff in.
That's
Okay.
fine.
All right, go ahead, John.
The utilities, I know there's a set amount that the city has billed, I think it was $100 a month, if I remember
I don't
correctly.
even know, yeah, I know it was always on there,
Yeah.
right?
Yeah, and the telephone, I don't see any huge changes for right now, but that's that planning thing.
Yeah.
We're we
That's
talked
where
with the
that's
chief,
gonna
we're
work.
looking at moving actually the 3366 and 67 line over here because everyone in Floyd County knows that number.
Sure.
And PD would be getting a new number, but that's all in
Okay.
planning stages, so.
Okay.
Yep.
That I'm worried about, because we don't pay for those two lines right now, the city does. So I imagine that will be rolling over to the county side for those phone bills.
We'll probably get it just merged into our system,
Ours.
and that's another thing we don't bill departments for.
Oh, okay.
So that's what, I'm finding this, it's just kind of, giving us a heads up as to how you've been,
Mhm.
how you're
Combine
trying
the
this
bills to
function
save
for.
money.
Oh, okay,
Yeah, okay.
I'm learning too.
No, that's fine, we're all learning.
The advertising, we put 300, it just kind of
That's
worked out.
Like posting for a position.
Job positions in the
Okay.
papers and the notices.
Okay,
Now, the question is, we had the tort liability insurance, that was for the tower, and,
Is that what that was? Yeah.
yeah,
And that also, again, those things,
Those
we don't
things are-
push those to the departments.
We
If that's
don't.
something you want us to start doing, you just need to let us know.
I don't know that we
Because
need
they're-
I don't
to.
think we need to, I really don't.
Yeah.
Yeah,
It's all
there-
general fund, so as long as we've got a mechanism to pay for it,
Right.
That's why we.
it doesn't
bill
make
them
any
as a different
difference.
I would say
Right,
no.
as long
We
as
do
it's
that for
general
mine.
fund.
Can we do that for my department?
No, yours is the other one.
No.
We always call that the other department.
But as long as it's general fund, then yeah.
I don't see any reason to
Right.
change it.
But it actually brings up,
I mean, these are interesting.
yeah, it actually brings up things like, we have the assessor actually has a separate levy. And we probably don't push some of that out to them either, do we?
No, one line
You know?
wasn't enough to mess.
Yeah, you just,
And with everything merged the way we did through the 5-year stuff.
right,
I talked
Okay.
about that at a party.
that's fine. I didn't mean to stop you, John, I'm
Okay,
sorry.
Oh, no, that's fine.
Go ahead.
There was one thing I was gonna talk with Gloria. We have two line items, one for office supplies and operating supplies. Now, basically, the operating supplies were like it was kind of I don't know, they've had it in there, but I'd like to just combine those to one because that's our printer paper.
I'm glad you said that, because I was looking at those expenses, and I'm like,
What?
why
Yeah,
are you?
why is one
Yeah,
versus the other?
streamline it. I don't know the process to get that down to one.
I would hope that maybe we
I
could
can-
just combine those
We'll
into
just put it
one.
in 260 code.
Right.
Office
Yeah, and
supplies.
the office supplies are 1,600, which is, we've always had leftover, and the 700, we pulled out of there for, I use that for like the drums for the printers and that.
Okay.
But, it talks, a lot of places, I think, order paper at once to get it a lot cheaper, so that's something, that's
Yeah,
still
we'll have to-
figuring out,
Sure.
Yeah, we, and, yeah, that we do, we could do that, we can talk about that.
Yeah.
We do order bulk paper, and
And
then
then
the
you get it
departments
for less
just,
money.
the departments just sign out how much they're doing.
Yeah.
Okay, well, those, the office supplies are 1,600, I'd like to keep that there for right now this year. If you use it, we don't, know, so we get figured out into
No,
the, thing.
Right
And
now
yeah,
with your move and everything, I think that's probably a good idea. You
Yeah,
know, because of
that's-
your move, because we just don't know, you know. it might be- yeah.
Books, tapes, updates, that's another one I feel that, could probably fall under the training budget. The travel and meetings, that's where we get all of our training expenses. It was just another line item that has been in there, and, you know, like if I ordered CDs, that would fall under that, but that actually falls under training. And I think we could just get rid of that.
Okay.
The capital equipment, that's for like chairs, monitors.
See, our capital, the county has a $5,000
Yeah,
set
that's-
for capital.
that's
So
what
how
ours
much is in yours?
So,
Ours is 5.
well, ours is 5,000, the item has to be 5,000.
Oh, okay, that's what we
Otherwise, it
budgeted
comes
in
back
Otherwise,
here.
it's not capital.
So
Yeah.
we have, we could go through that chart of accounts and kind of look at what might fit better for
all
them.
right.
Okay. Yeah, and that's kind of the ones that we do know.
Okay.
Okay.
As far as the expenses on moving, you know, that, I know we put money in 911 and we don't have those.
Well, some of those expenses are gonna be done before the fiscal year because they'll be done before July
Well,
1.
that's just it,
Yeah.
and so this really, we're
So-
talking about
Yes,
after
after-
July, and
after
so that's
July
why
1,
some
right.
of the questions I had of Gail too, we gotta remember, there could be expenses, but it's in this fiscal year
That's right.
versus the
And
next.
then I believe we budgeted some money set out for the
I thought so.
911. I think it's 100.
Okay.
What do you mean here, the
Well, 911 can pay for certain things for the dispatch, like the furniture. I'd have to get that list after.
Yeah, I was gonna say, through 911, I know there was a list of approved items.
Yeah,
And then I
They're
think there
not
was
paid for
a,
out of ambulance?
yeah, certain things as far as that we can,
yeah,
911 from.
but that,
So they aren't budgeted here?
no.
Okay, that's what I thought
No,
they
no,
were.
no. No, 911 actually said, we can pay this much, and the motion sticks in my head a couple $100,000, and they said they
Yeah.
would put up to that amount towards it, so.
Yeah. But that would be in 911 budget.
That'll be 911.
Yeah, 911.
Yep.
Those are the ones I do know about, is just the payroll, the overtime, the
Okay.
FICA, IFRS,
All of that.
stuff like that, which Nicole will be getting this afternoon.
Okay. And right now, we had told everybody
Sounds good.
2.5% on payroll. So
Okay.
that should follow through on you guys for now. I mean, that isn't carved in stone, but that was the direction
Just
we
for
gave
budgeting
them to start
purposes.
with. Just for a number.
Okay. So is there anything else, John?
No, I guess, as far as the overtime and the salary, as far as the overtime budget, you know, how we do it now, you know, our holidays come out of the overtime budget, are we gonna keep it that way?
What had been discussed?
So, we have a line item that we build for overtime, but it's not necessarily going to be overtime. So we typically do the holiday out of regular wages, but we track it that it's, say 8 hours for holiday or whatever it is. But if it, I think we just, I don't think we'll have a holiday line item if that's what you're thinking, but
Just still
we'll
have,
just,
but
yeah,
So you gotta be
So-
regular salary, overtime salary.
yes.
Yeah, I would think one or the other.
Yeah.
So it's just working on the details on
Yeah.
how they're gonna, how they come
So
in.
there'd be, yeah, we just need to figure out how we're gonna do that. So I'm just gonna be a simple example. Somebody has a 40-hour work week, and there's a holiday in there. Do we put it at regular pay, or do we put it, they get time and a half if they work that holiday, plus they get the floater holiday pay, so we just gotta figure it out. That, plus we get a floater. Get rid of that, we do 2.5 times or whatever times.
And anything else?
Now, kind of a learning process on the budgeting.
Again, welcome aboard,
John's doing great.
and we'll get through it.
And the other thing, John, is we do a bottom line budget. So if we actually put the money in regular pay and somehow it figures out that it's paid for overtime or whatever, it'll all come out in the wash. in the end.
Okay.
Yeah.
Yeah, so, we- just so you know that, we look at it as a bottom line, you know, so. As long as we put enough money between those two, we're in good shape.
Okay.
So that's it, we appreciate you coming, thank you very
Yeah.
much. And you can work with Gloria, you know, on.
Yeah, we'll have to
details
have
and-
numbers.
Yeah, and we were gonna work on that after it's all done.
Okay,
Yep.
all right, sounds
Okay.
good. All right, well,
Thank
thank you
you,
very
John.
much, appreciate
Hopefully
it.
it'll be a little bit earlier than later, because I think we might be able to move the 2:30 up and get them all done.
Okay.
What, time frame?
Today, you mean?
What time works for you?
I'm old.
2:30?
2:30?
Yeah.
Okay.
Okay, good.
Yeah, that
All right.
one. All right.
Well, thanks again, John.
You betcha.
Sorry about this background noise.
Oh,
Yeah.
that's all right.
That's our normal.
But normally they're not like right there. I'm used to hearing them. Okay, so, all right, I'm open for suggestions since we have, I know we got Dusty here.
Well,
Next is Bernie, actually, if he's out there.
If Bernie's out there?
Bernie
Yeah.
was out there. Oh, you wanna get him? Here.
Okay.
I'm doing stuff here anyway.
Are you, okay, well, I'm just trying
no, I think that
to
was
acknowledge that you're.
Dean's, yeah.
Okay.
Who's that?
It was Dean.
Oh, Dean's.
Dean,
what's that?
oh, what did you forget?
Hi, Bernie.
He's
52, okay.
Sorry about the door, I heard that they were doing.
Well, I know, you just have to be really
gotta
careful.
Yeah, we don't want people to believe that we're not allowing them in.
No. Noise or not.
Right.
52.
Okay, now, 40,
Yes.
40 for this one.
Like the last pages. Got it.
Yeah, they're
52,
better.
okay, got it.
How come your revenue doesn't have anything on it, Bernie?
You know, I was gonna say something to John too, I was gonna give him a hard time. It's like, okay, we always do expenses and then revenue.
Where's the revenue, Bernie?
There used to be revenue,
All
go to
right.
GIS,
Oh,
but
yeah.
that's no charge anymore, so.
Okay, Bernie, you're up. Go ahead and walk us through this.
Okay. So, normally the IT budget's right around 190,000. Last year we went up for the AS400 and the possible move for.
Possible move to 500 grand. We did.
Yep. And this year I'm proposing a new server for our Hyper-V. It's getting to a point where storage is getting low and it's getting to be older equipment toward the end of its life. And
Is that the
Which one is
110,000,
it?
Bernie?
Yeah, which one?
that
So,
is the hardware IT capital.
You went here to 10.
What's that?
Oh, capital.
Capital, 18,632.
22,000?
22,000?
I was looking it over.
Okay, so again, that's for a new,
That's for the new Hyper-V server and licensing.
Then this is 600 code in the budget?
632, yeah, and I was gonna make
Okay.
that comment, but I forgot to have a project code made for that, so I made that one. So if we could get a 35 project code for 632, that would be great.
So 22,000 is the Hyper-V server.
so what's the 110?
Yeah,
The 110 is the
Like
technology services.
solutions and services, it's,
so is it just, did we move this over to this budget?
That's what it seems like we've got
Because
some
it
numbers.
wasn't there before.
Well,
Last year it wasn't there.
are you looking at the project code 35? Because it was usually 421 without the 35, and that's where it has always been.
Well, there's what, I think.
Oh, I see. So on 421, above that is 100,000.
Right,
Correct.
And now it's moved down to this one.
because you created a code for it.
Thank you for the
That's why.
explanation.
22
See,
there.
and I didn't understand that either.
Or do you want 6:30?
32.
Oh, and I put it on 6:30. Is there? Wait, or do I have it on the wrong
Yeah, it's there.
one? Is there?
I just didn't see it listed on the other side.
So if you look at the 632 on the left side, it's, there was a 636 for office equipment furniture that's blank, which we could probably, I could probably delete that one.
See, in some of these, I mean, if we just plain go back up to the top, that's what I think is confusing too, is that we had several line items for IT supplies. Again, other lines, now you've got 35 code that you're.
Correct, that's where I put
So
it.
that's where it just seems like there's different line items
Yep.
that we have to look at versus just
We gotta
one
move
straight
it down.
across.
Yep.
Yeah.
But
That's-
you want the 632 to have a 35 code.
Yep. But for some reason, I was thinking we don't capitalize stuff that we would have in the project.
Kind of this one's your budget, so you probably wouldn't even need 35 codes because it's just
It's all
35
lots.
code is just to
Information
see.
technology.
Right.
Yeah,
Yeah.
so you probably don't even need a 35 code, so I'll leave that up to you.
Right.
Okay.
So
Build
bring
it
it-
or leave it as it is.
So
Yes.
can you,
But do you track it somehow with the 35?
I could give him a report for project
I
35.
thought
So he
so.
could either take that report that all the other departments have
Mhm.
and add his own, because yours is all IT.
And we discussed that last year because it was part of the discussion of, do we want to put all the
Right, I
IT purchase
remember.
stuff under IT?
Right, yeah. And then we decided to put 35 codes on them.
so we can track it and.
We can
report it.
identify them, right?
So it's up to you if you want to use these 35s or not. It's up to you.
Everybody else does, I can too.
Okay,
Okay.
okay, I'll build that one then.
Okay, help me understand what the 8,000 for telecommunication services is.
That is our fiber optics.
Because that was
Connection.
34,000.
It, right, and that was where we put the fiber for the middle school.
That's what I just wanted
Oh,
clarification
so
on
it was
that.
money
So
we
again,
budgeted but actually never used.
we never got used.
Correct.
That's
Yeah,
good.
well.
And so the 8,000
it-
covers the 5,800, I think it is, for the fiber optics we pay for from the city for our internet access. And then my cell phone costs, which is minimal, but a little bit of a cushion in case it means something else.
Okay, so let me just run this by, I've talked to you before too, and again, this is in current probably versus future, but things like a booster, you know, I told you where we need to go into the new facility and check cell phone service.
Yes.
And the project always said we may need some sort of a booster on the top of the building. Would that come out of?
That's a good question, because I mean, I don't know.
And I'm
I mean,
saying there's gonna be other things like that. I'm just
Mhm.
using that as an example. I have no idea how much that would cost.
Does that come down to, because and I'm only asking because, I mean, in the past, like the cameras were building limits, right? And they have security locks. So I didn't know if a cell booster would be.
It's a good question.
Yeah, those are
Right.
things
Kind
that are
of
gonna, I think
things
there's
were
gonna
attached
be
to
more.
the building. They were attached to the building, we trying to put them under building.
Sure.
And Divert the 10.
So let's kind of
But
find
IT
that.
stuff attached to the building can be removed, so I don't have an answer
It is
for
a
you.
part of the communications. I mean, it really is to boost the.
So some of that could come out of this budget for this year, you know, if we need.
It's
So I
the
just
phone
wanted-
system still comes out of building, doesn't it? Doesn't come out of IT.
Correct. Well, correct.
You know,
Yeah.
I'm just trying to relay it to other things.
Yeah.
Well, like I said, chances are there's gonna be more items like this that just get mentioned, oh, by the way, we're gonna need something, and I don't know either, even with the move of,
Well, when you say
Dispatch.
communications, is it just for the dispatch center, or was it because the sheriff's office didn't think they were going to
it was brought to my attention early on in general by the architect, I think it was, that, hey, we've had this experience before when you've got so many brick walls in a facility like that, that you just beware, you might lose the reception.
For
Within
cell
the new
phones or
facility, yeah, they were talking cell phones.
Okay, so I don't know if is that communications then, or is that?
I don't know. And so he was gonna walk around, I know, with a cell phone the other day or whatever, and just try to experiment and see. But again, I'm just throwing that out as an example. There could be other things that come up like that we just have to,
So this would be the time to direct us which way you want us to go with it.
Well, I would think myself that it would be something that could come out of this budget.
IT.
Do you agree?
Well, I do, I'm sitting here thinking like Wi-Fi boosters, you deal with all that. You know, but then cell phone, that comes back to, is that a communications thing? And that's why I asked about the phone system. See, the phone system comes out of the building.
Well, and I'll say the phone system comes out of the building because it wasn't a VoIP phone system when that was created.
Right. So that may get moved over too eventually.
Leans more to IT because it's
Right.
internet-based.
So if you want those
We can do
switched,
this out of IT, I don't have a problem with that, I'm just trying to,
Well,
Keep
it's
things
just that
somewhat
now's a good time to
standardized.
think through this as we go through the budget. Like I said, even if it comes out of this year versus next year, these are gonna be, I think, some additional
Well-
items that we're gonna have to address.
is this a number that we know that Bernie can add to it, or is
No.
this just
So,
a,
well,
We're gonna have
you
to
would
figure
one
out
of
what
those
it
out of the
is, and
sky?
I can have another meeting with you after we go through that, the costs and stuff.
and then, so
Yeah.
do you want like the telephone to be switched, even if it's switched July 1?
It could sure happen,
Nothing budgeted now?
it could sure happen.
That what you want us to do?
Telephone, security, the electronics on the doors.
Yeah, because I met with Communication Innovators last week, so the system they're putting in is intercom, security, camera, so I
Right.
think that would.
Yep, yeah, the cameras.
Well,
Yeah, and on the, we don't have, unless we have a, like the door system currently, unless we have an issue, there's no, you know.
There's no, sure, but in the future, that's
So
the direction we
future
should
you
look
want
at.
it there.
I have a
Right.
problem with that, you know, if we make
Yeah.
that change. I don't
Oh, you don't
have a
have,
problem,
okay.
no.
Yeah, because it's not like, if you think about it, Bernie deals with a specific desktop in somebody's office, whether it's mine or somebody else's, and we take that out of that department. But in the case of doors and cameras, and this is all general.
Good, I'm good with it.
Oh.
Yeah, I was gonna say that probably
Yeah.
helps you a little bit, so it's not on the building.
It's not gonna change the cost of it, it just changes how we look at it budget-wise.
Right, exactly, and that's all we're looking at.
Yeah.
It's like I said with Gail, you know, I'm trying to figure out on some of those things between her budget and the EMA one, you know, it's.
We have to get together on those numbers then.
Okay,
Okay.
sounds good.
All right, anything else, Bernie?
Let me ask you this, on the Hyper-V server, you and I have talked a little bit about that.
Yep.
This is something that's on the radar, it's gotta be done at some point. What happens if we don't do it this year?
Right now, we have like 180 gig free on the server, so we'll be looking at spacing stuff off somewhere else,
Okay.
until we get a new one, we're that close.
I just, you know, when it comes down to the nuts and bolts of this whole thing, we're gonna look at what can we afford this year, what can we
It does,
not
and I
afford
know,
this year?
and
that's why my question.
It's like a maintenance thing, at some point, things need to be
Yep.
upgraded, and that's how I categorize this one. We're just at that point right now.
And it was part of my
Based on
5-year
business.
plan too, that we were gonna be getting there in the second or third year.
Yeah,
So-
that was your 5-year plan.
And the other part is, we do have to have an SQL server for the security system, IP cameras and all that
Okay.
stuff. So we need to add another another virtual server to accommodate that. And right now, we're kind of at the top of what we can do with the server again.
Okay.
All right. Anything else, then?
No, excuse me. On the 110,000, you notice that went up from 100 before. That's because we've acquired, things are getting more expensive. The new data system, we got a little bit of an uptick in the annual cost. And so we got that. We've got a couple other things, SurveyMonkey, some WebEx, that kind of stuff. So that's really about it.
I I know we've talked about the solutions contract in the past. Do you still feel comfortable with where we're at on that?
Yes.
You know, yes, okay, that's fine.
I really don't have
That's
an
fine.
option otherwise. If you want your budget to increase, you know, like Tyler or something,
That would be it.
you're gonna spend.
Well, I think he was talking about the gold or
No,
something.
the level
The
of,
level of
Managed care.
service.
Okay,
level
okay,
that we
we're
get
not
from
talking
Rise
solutions.
versus.
Because we've talked about, yeah, which level are we gonna use, and
And I left it there.
And I
this time.
understand.
I left it there this time with the new law enforcement center coming this year. We don't know
okay,
how it's gonna be yet.
Yeah, because
Yep.
there could be a level of risk that we don't want to take by making a
Right.
change at this
I
time.
wonder
It's all right.
if we
Yeah.
add them, if we need to add them as a provider when they move over.
Oh, so I've talked to John about that. They have to become certified with the state for the corrections part of it and all that stuff. And we're looking right now into it. I would ask Max and Greg if they ever have or if they can provide documentation for it. But there's still that gray area, you know.
Is something different than like.
They had someone else taking care of their IT stuff for dispatch before, so it's kind of a transition thing,
Right.
if it's gonna be a transition, so.
okay.
What about, we talked about this last week, Bernie, too. IT things that we need, like for the boardroom, and, you know, if there's gonna be some additional,
Right.
do we
So-
put that under your budget?
Right, and so like on the IT capital, it's 22, and I figured we were gonna have some of that, and possibly, you know, like we discussed this morning, are we eventually gonna think about moving the server over there? We're gonna purchase stuff right in there. So the
Right.
actual server cost is around 14.9, and so that 22 provides us with a little cushion for anything else we would need during the project, switches, that type of stuff, because the switches are all over 5,000 apiece, so.
I did, because it kind of led into a discussion that Bernie and I had this morning before the meeting. I did talk with Tim Nordlund yesterday, and kind of, it was relating, like Lori, you and I had spoken about, you know, just trying to get our mind around, especially during budget season, you know, where all these dollars are coming from and what isn't going to be included in project costs, whether it's contingency or soft costs, and it's gonna be on us, you know, and what that might be. And so I've asked him to give me, there's a document that they have worked with and with other companies before. I said, let me see it, so maybe we can start making that list, because there are things, and I know you and I have talked about it in the past, but it's like, okay, we've got to really focus on this now, because if they truly are dollars or anything that needs to be purchased and it's owner purchase, how do we want to handle that? And making sure that we have visibility to that. So anyway, I just thought I'd let you know, I did talk to Tim about it yesterday.
And
so-
that kind of combines what the call we had with Tom Justin also, and where we put those things to. When we do the Department 10 budget and Department 51.
Okay.
Okay, so anyway,
And
is that it?
one last thing I was gonna say is, you know, the Hyper-V server, we could put it on the next year's budget, or, you know, as we discussed this morning, we have money left over from what we budgeted for the new one over there. So there's that option, if we wanna do it now, as opposed to waiting. Your call.
So you're saying your budget could absorb that without an amendment, because you've got balance left,
There's all that,
but,
not moving over to.
Because we just,
Yeah.
we came up with a figure last year just to put something in there, because we didn't know for sure if we were making that move, and we had some quotes and estimates on that. But that's why I told him too, I said if, you know, whether or not we spend it in this year's budget, because he does have funding available to do that, then it would come out of this budget.
And it could also help with the boardroom.
I was gonna say, maybe we wanna wait on that decision until we see how the boardroom comes out, or whatever else, you know, if we decide that this cell phone thing out here has to be done to make that functional out there, that's gonna be before July 1.
For those, just so
money
you know.
for that that needs to be used.
They're anywhere from $600 to $1,200 for the boosters.
Yeah.
So if we need a couple, two.
Just little
I
things.
kind of lean
but-
the other way, that since you're not doing that cost for North Grand, that maybe the Hyper-V is a good thing to get, because that will be,
And we'll open up the SQL part of it for them.
Yeah.
I mean, I have no problem, and that's why I discussed it with them. I said, I
Right.
know that we bucketed some money in there last year, and I was just asking him, how much is it, you know, that we still have not spent because we chose not to make that move.
Yeah.
And on the current Hyper-V, I mean, with the changes that are going in, the Access server, which runs the security system now, it's my understanding that's going away once the new security
communication
system.
innovators.
So we would have room for their SQL server now, but it'd be nice to start new, you know, with it and not have the space issues.
Okay.
Okay.
That's all I
That
have.
sounds good.
Oh, in your wages, you use 2.5%?
Yes.
Okay.
All right. That should be it. Bernie, thank you very much.
Thank you.
Thank you.
Okay, next.
Look on that revenue.
Yeah, get that revenue sheet. I want to see the revenue.
We can start selling old equipment.
All right, so, do we want to hop to Dusty? We've been hopping.
Jeff Sherman is going to be rescheduled to the 18th.
Okay,
So Dusty is 11 o'clock.
Time is it?
Or unless you want to, well, his agenda, actually, a
he's
lot of
got
the
agenda items on here,
are
and that's
his.
why I'm saying. I mean, we could certainly bounce back. Let's go back to.
Your number 9 isn't going to take very long.
And that's why I'm saying, I was just going to say, let's go back to 9. So let's go ahead and.
Okay.
So anyway, item 9, review/action regarding resolution 06-21, the South Grand Urban Renewal Area, Charles City, future incremental property tax revenues for 16 fiscal years. And we talked about this yesterday.
Right.
So we had shared what Steve Deers had provided. I guess a question for you, Roy, is there anything else that you have
No,
a question on with that?
I was comfortable with it. You know, the city is got a good program going, and they're just asking for us to sort of partner with them, but agree to it. So with that, I'll make a motion that we approve resolution number 06-21, South Grand Urban Renewal Area.
All right, I'll second. Further discussion? All those in favor say aye.
Aye.
Aye. Motion passed. All right, we still have then item 11, which is review/action regarding appointments to various boards/commissions. We talked about the 2 that we could go ahead with. I don't know if you have any updates on the 3rd one yet, but on the magistrate. Okay. So Erica Troina and also Kip Hauser.
Kip Hauser, and who was the other one?
Erica Troina?
And we don't know about Harlan. And
No,
don't
okay.
see it, I don't think I've gotten anything from Doug, so I'm going to guess.
And that was for the
How
magistrate?
long is that for?
Is that what
6
that
years.
is?
6 years.
List.
So we have that, and we can do that as a separate motion. And then we can do the second one, which again, we talked about the Drainage District 1,
The reclassification commission.
and who would be working on that as
So
support.
I'll make the motion that we appoint Erica Troina and it says Carl Kiphauser to the magistrate appointing commission to a 6-year term.
All right, I'll second. All right, all those in favor say aye.
Aye.
All right, that motion has been passed. And so the next one was 2 appointments to the Drainage District 1. And we had, pardon?
For the reclassification of Drainage District 1.
And it was Jim Jorgensen and also Scott Jaden. right, so I'll go ahead and make the motion then to appoint Jim Jorgensen and also Scott Jaden to the reclassification work on Drainage District 1.
And I'll second that.
All right, motion made and seconded. All those in favor say aye.
Aye.
Motion passed. Okay, and I think that was it that we could do today. The
Well-
only one I do want to note, and did you get the email too?
Yes, I did. I was gonna bring that up.
I printed that out.
I didn't print it, but
I did, and it was from Julie Opperman, right?
I'm sorry. Your motion for commissioners, you also need to appoint Karen.
Pardon?
You also need to appoint Karen Ruby.
Oh,
Oh,
all right.
I'm sorry.
All right, so I will go back to my motion. I will appoint Jim Jorgensen, Scott Jaden, and Kent Rhodey to the Drainage District.
And I will second
classification. All right, motion made and seconded. All those in favor say aye.
Aye.
All right, motion passed. I didn't realize we could also appoint him. Okay, all right. So again, then back to a vacancy that we do have on the eminent
Yes.
domain / condemnation board.
And then we just need to note it at this point because we need to look for somebody. I was trying to figure out Julie Offerman gave us a notice that she needed to be off that board. Is there certain qualifications that she fit or?
Just that category.
Just that category that she was
Like
in.
property knowledge.
Okay. I don't have
Not
that
a
one in
realtor.
front of me, so
Realtor.
I'm sorry.
No, because realtors have their own section.
Its own categories.
And it was unfortunate, but she really gave her, definition to us as to what she had done, to make sure that it was, that she felt it was okay to be on it, but they
Yeah.
had a conflict, so.
Maybe difficult to find a female to keep it gender balanced.
Yeah.
Yeah.
So anyway, we'll just note that for now,
Okay.
on that one. And was there anything else on that line item? Okay, if not, we'll move on. 14, review / action on resolution 08-21 for the county employees to take vehicles home during winter months so that immediate response can be made to eliminate or reduce hazardous conditions on county roads. Dusty.
So that resolution, basically, I'll read it because it seems like there's misinterpretation in my other county. So basically, for unforeseen weather conditions that do frequently damage Floyd County secondary roads, thereby creating situations that are hazardous to the traveling public. And whereas damages arising from the accidents and the other actions by others created hazardous conditions on secondary roads that can result in damage or injury to the traveling public. And whereas the above actions may occur anytime, day or night, it is therefore determined in the best interest of the county and the traveling public that certain individuals be given the responsibility of being available on a 24-hour basis so that immediate response can be made to accomplish temporary repair or installation of warning devices to so inform the traveling public of the conditions. Persons so designated shall be authorized to take vehicles, communications, and other equipment to the residences during time other than normal working hours. Vehicles and other equipment are used for official purposes only. Basically, we've seen this over the years with the floods. It is a benefit to those employees to be taking the vehicles home. I recognize that, they recognize that. And I take mine, actually, just it works for me because I'm in transit between here and New Hampton for Kingstown County anyway. I do have it on my time card as a taxable benefit.
Because you're not carrying that.
Because I'm not carrying certain equipment, which is the lift gate and or fuel tank, which the other ones are.
Okay.
In situations where we've had the floods and probably the snow events, the blizzards, those guys being on call, I mean, to get to a road that is washed out in advance and to not have to waste an hour to come or a half hour to come to town to a half hour to get to the thing, I think always any reason not to allow it. And this has been going on for long before I was here. I mean, I've been here 20 years, coming January 22nd now. And I think Lyle had it long before I was here. I don't see it as it being abused. I don't see it that at all. I see it as they know that it's for business purposes only. And I recommend that we would pass that, or you guys would pass that to allow that to continue.
It's like you said, I was going to ask, do you feel it's ever been abused? And if it hasn't, I mean, I think the benefit outweighs something because those floods, they happen. And
And
we've
it's not
had
every year.
that happen,
Does-
roads wash out.
Does the other county feel it's an because it's an IRS thing, it's not that it's an IRS thing, but do they feel doesn't meet the IRS requirement?
No, they just feel that it's being abused, and I don't believe it is.
That's why.
See, the workers, they're at the shop. Look, I brought it up this morning to my guys here, and I bring it up over there, and to me, the guys are at the shop at 6:30. What you see on their timesheet is 7 o'clock. So, they're coming in early to check guys in, and to get things started before it even goes. The employees show up 5 minutes, 10 minutes to the hours they start, and they're there 5, 10 minutes out here. It's similar, to think that is being abused, I disagree. And they're not putting down that 10, 15 minutes that they're ahead, or like Tim, I said, what time did you get this morning? 6:30. Well, it's 7 o'clock on the timesheet, so, the county's not losing out on the fact that they're taking the vehicles home, but by any means, in fact, they're committing more time than what they put on their timesheet. So I'm thinking it's being abused, if you stop and grab a cup of coffee because you get a cup of coffee. My gosh, I don't see that as an abuse. And that's on me, I don't see that. Now, if they were traveling to Waverly to go pick up ball games or something like that, then that's abuse.
That's different.
Yeah, that to me
All the
is.
kids to school.
Yes.
Right,
Yeah,
exactly.
we've run into that before, with, I think, myself, with the sheriff's office, we all talk about that, what are the appropriate uses, so to me, stopping and grabbing a cup of coffee is they're putting more time in than 2 minutes stopping there and getting a cup. I don't see it as that as abuse, so.
And we've got a policy in place that doesn't allow the use, to allow family members or anything like that to ride in their vehicles.
No,
That's,
it's kind of one of those,
yeah,
I think we talked about that before.
yeah.
I think during the floods that one year when I went out, my wife wanted to come with me because we had 14 inches of rain on my Marble Rock.
Mhm.
I took my personal vehicle because
Sure.
she didn't want me to go by myself, and I was out there checking
Right.
roads and all that. And then you had kind of said that, she says, well, in that case, an emergency, it shouldn't matter, but no,
It shouldn't.
I don't.
Yeah,
Yep.
But where that is in your handbook,
Yeah.
right.
Right,
about not
Yeah.
having,
yeah,
but there are different rules for the sheriff.
yeah.
I'll tell you what, this is one of those that, I look at it and I think to myself, are we seeing, if we are seeing any, but are we seeing wear and tear on vehicles that above and beyond? Probably not. Are we seeing the ability of someone being able to respond directly to a problem, no matter what? That's a plus in itself.
That's a plus.
And
Yeah.
that is probably the biggest thing in the emergency, and I'm trying to get that to people to understand that, look at the floods years we've had. We've had 2 events
That's why
in a
I'm
year.
bringing up the pluses. Some of those roads have been terrible.
And the minimal cost that it is, yes, it is a benefit, and they realize that. They do.
Yes.
Yeah.
I realize that, I do. And it's not just emergency situation, that's kind of what the state, but there's other cases where they're gonna stop at a day labor project and
Yep.
start a pump before they get to the office, so that when the crew gets there, that project can proceed, and you don't have to wait for 2 hours for the water to go down.
Perfect example.
That's it, and that doesn't happen all the time.
Yeah.
But that is a couple of occasions. They'll stop at something on the way home to look at, hey, I had a call on the road here, can you look at it on the way home? Kelvin did that many times. And stop and look at this, and then, hey, I was there, and it was even after probably his timesheet said 3:30 when he left the shop. But, he still stopped and looked at stuff, and the guys do that, so, it's a very minimal cost. I penciled it out, it doesn't amount to a couple $100 probably. And to me,
Yeah.
I think the chance that you could save a lawsuit on
Right.
road closure or something like that
Right.
outweighs that by big news.
Well, with that, I'll go ahead and make the motion to approve resolution 08-21.
And I'll second that.
All right, motion made and seconded. All those in favor say aye.
Aye.
Motion passed.
Because I had the one good before the numbers were, whenever you get to that one.
And then we'll just move right into the next one then, Dusty, which is item 15, review/action on resolution 09-21 to the Farm to Market Review Board to modify its farm to market road system.
So, this is what we've been discussing for the last year or so. It wasn't so urgent, and it really can hold up longer, but the Farm to Market Review Board met in December. Actually, I think they canceled their December meeting because there was no urgent topics on it. And what the Farm to Market Review Board will review our farm to market system out there, certain roads in the county are designated as such. With the project, interchange project at the city of Floyd, our farm to market extension that goes through towns under 500, and Floyd is one of those towns, is we have a 28E that I maintain the center 24 feet of the existing route, which is not the main exit by the gas station, but you go past it further west to the very next one. And then that road curves by Dugan's Restaurant and north, and it heads north out of town on
Right.
Quarry Road.
Right.
With the new project, when that happens in the next couple of years, I would transportation, that interchange will be eliminated.
Eliminated.
And so we needed to
Right.
alter our farm to market road to tie into and have continuity to tie into where it ended up, which is Highway 218. So with that said, we've got to pass this resolution understanding that we're going to eliminate basically Adams Street from 3rd Avenue all the way down to Montgomery Street, which is Highway 18/27, which is the existing route. And then we're going to change it to, as we're coming in on Quarry Road, it turns into Adams, and then right at 3rd Avenue, take that east 3 blocks to Highway 218. So the total subtraction is .46. I went down to the,
Yeah, you did.
I went way down.
0.4611
I didn't know how far I was supposed to go down, but I
miles.
figured I kind of
Oh,
measured
gosh.
it on there.
Yeah.
.4611 is eliminated, that's where it basically stops, and we eliminate that section. And then we would add the .1937, which is the 3 blocks that goes across. The city had already passed their designated truck route for the city, which is 3rd Avenue.
Okay.
So they have already pushed that. I was kind of taking my time here, I was kind of saying, okay, we'll get to it, it's not closed yet, blah, blah, blah. But since they're meeting in March and just to get this reviewed, and I've been working with the city, I think the city council is Brad Floater, he's also attorney, I believe. And Krista Rostad with the DOT. And then what I do is I'll take this, once you guys pass it, and then I do an engineer's report, which I've already got, it's pretty basic. Everybody knows why this is happening because of that DOT project.
Yeah.
And then I will take that, submit all this to Office of Systems Planning, the DOT, give everybody copies that need it. And then the Farm to Market Review Board will basically act on this. There's no hiccups here. It'll be, yeah, we understand why, blah, 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 pass it. And then, once that is complete, which will be in March, I'll get notifications from Office of Systems Planning or Farm to Market Review Board. And then we have the 28E, which currently shows that farm market extension. With that 28E, that basically I turn around and maintain that center 24 feet, and because I am getting a portion of the city of Floyd road use tax fund, I turn around, and that's in the budget line item, I turn around and give the city of Floyd back their money, and I still maintain that farm market extension. And outside that center 24 feet, the city maintains, like signs,
Right.
any stuff that's within the right of way. That's just something that, you know, I wouldn't have to give any money back, and I can maintain all the right of way, but I don't want to have to worry about city, in the city or anything like that. So, once this is all said and done, then we will get back on the agenda, amend that 28E agreement to match this, and we'll continue with that. In a nutshell, that's it.
No, that's fine.
Well, with that explanation, I'm going to make a motion that we approve Resolution 09-21, Farm to Market Review Board application.
All right, I'll second. Motion made and seconded. All those in favor say aye.
Aye.
Aye. Motion passed.
Thank you.
All right, so
Yeah.
you want to continue then, Dusty? We'll just move on here to the next item. Line item, which is,
Not a lot of them, but I think I just followed the example I had from before.
all right, so let's talk about secondary road activities.
And I'll put Doug's in his box upstairs. It's kind of become the same. I mean, the winter's been treating us good right now. So we've been a lot of brushing, which is a good thing because, you know, every year it seems like, what do you do with all the brush encroaching and this and that and the other. So we've been doing a lot of that, boom mowers, some other work order. We had some riprap scour problem on a bridge south on Old Highway Road. Basically getting day labor projects ready for next year. So we're gonna be getting some, we'll have it on the agenda in here to open up bids like we did last year with at least, I think 3 projects. 2 would be day labor, 1 would be maintenance, but it's big enough that bridge contractors can provide us with the box culverts type thing. Basically did the brush clearing that needed to be done on 180th Street. I think I talked about that last time. That has to happen in the off season so it doesn't disturb the backs. For our project, which will be let next Wednesday, is our pavement marking lighting and our bridge lighting for the 180th west of Canyon. So it's a good year for brushing, which is good. I mean, and we're saving money. I get that. As far as overtime, but we still, still have all of our employees here doing still work. So we do save some, but we still are paying our employees to do other stuff. So.
I keep waiting. I know.
Yeah, chance to snow Thursday, Friday, but outside that, past that, it doesn't sound like a lot, but then it is, and then it sounds like a
I
nice
keep
week again.
waiting though, it's like it's gonna hit, And Bob's just hoping it doesn't, because you've had some really nice driving between here and
Yeah.
Mason City,
Yeah,
except for fog.
2019, I think, was bad. Yeah, a little bit of fog stuff here.
Yeah.
So that's really about,
That's about it.
yeah. You got
Okay,
anything?
everything get resolved out at the dump site?
Oh, we can talk about that. That's all right. That's part of my department, I guess. So, I've had a few calls about people complaining about our policy per se, and it's unwritten policy. It's just agreed upon that we're only allowing 1 vehicle in at a time. With that, I talked to Karen last week, and it was, I said, at her discretion, you can allow, as long as people are social distancing, I don't have a problem allowing more than 1 in there. If one's at the dumpster, one's at the recyclable, that's fine. If one, and if she just works with them. And I've had several calls. One I'm not following those rules anymore. And I said, well, if you're not gonna
That
follow
wasn't
those
the
rules.
call I got.
That's probably the one I got.
Oh, you got one too?
I got one too.
All right.
And I won't mention anything, that's fine.
But I told them to
basically said-
contact you, and they did. That's what.
Yeah.
And I
that's good.
basically said, well, if you're not gonna follow the rules, then we'll get the sheriff involved. I'll get the board supervisors involved enough to send you a letter saying you cannot use this site anymore if you're gonna not follow the rules that are set forth.
Right.
That being said, what my argument with this person was this. It says, about the time, we talked about this about 2 months ago, about allowing more than 1 in there, as long as they're social distancing. And about that time is when the governor put on the restrictions because things were spiking. And this is the way I explained it to the person. And I said, so at that time, I said, well, we were about to allow more. And it doesn't have to be an official notification. I can slowly just allow Karen to, hey, use your discretion. Allow more people. And so I have done that. But at the time, with the argument that it was a couple weeks ago was, I said about that time things were spiking. And so I said, to be safe, I'd rather be safe than sorry. And his complaint is, well, I'm not gonna follow the rules. And I'm like, well, if you're not gonna follow the rules, we'll address that later. And I said, neither here nor there. And I agree with you. I'm to that point, and I said, well, everybody's sitting in their cars wearing their masks. What sense does that make? And I said, hey, I'm on the same page as you. I don't wear my mask in my car, and you're more than 14 feet apart. You're social distancing. I get that. But when you go out there and you're standing right next to the person that's throwing their trash in there, now you're not social distancing. That's the reason of it. And because of the restrictions that went on 2 months ago, that was the concern that I didn't want to allow it. I said, hey, we can wait another 2 months. Let's get through the calendar year. Let's start in the next fiscal year or next calendar year and see how things go. I think things are coming down. And then talking with Karen last week, I said, just be smart about it. Just say, hey, when there's someone there, try to keep your social distancing and do that. And that's what you can tell people. And so slowly, just so you guys are aware of it, and it can be documented, that we're going to slowly allow people in. Now, the biggest problem outside that, so I think everything's kind of resolved, I think,
All right.
as far as that goes. And I just don't care, and use your discretion.
Yeah.
If people are not following what you need to tell them, and whether they like it or not, then they come yell at me again, and I bring it up to you guys again, and it'll be what it is. I think the biggest concern is that someone coming down the road stops in the middle of the road and is waiting in the middle of the road.
And
Now,
that-
I cannot
was
tell
the
people,
issue,
I cannot tell people how to drive.
No.
So unless
That was
you
the one
guys,
that came to me.
And I
Yeah, they
think-
must have called it what they called.
Somebody said the ambulance.
well, it's very, and with that, there's also people parking along the shoulder. So to me, can you park on the road? Well, what are our options? And I told the guy, I said, I can't tell people how to drive smart. If you're gonna stop in the middle of a travel portion of the road here, that's on them, not me. Second of all, unless you guys, as a board, would wanna purchase more property to make an on-off, turn off into an area to
Like the
designate it
ethanol
to,
plant did?
very similar.
No.
And so we're always gonna have that problem, whether there's
Yeah.
5 cars or 10 cars. There's only enough room for 2 or 3 cars in there anyways.
Right.
So
Yeah.
it's an issue that I can't tell people how to drive, and if they have to wait on the edge of the road, they have to wait on the edge of the road.
Right.
And if someone stops in the middle of the
And
road,
it's
again,
not
I
like
can't
it's
stop
on a
that.
hill either, because I'm trying to visualize, I mean, they can see
can
cars,
see.
so that you can get around
Yeah.
cars. It's not like it's stopping traffic.
The one that stopped made no sense to me, and I can't even tell you who it was, because the person complained about that, and I said, yeah, I can't tell people how to drive.
Yeah.
So that was my only
All right, well,
discussion
that
on
was,
it.
I just wanted
Yeah.
to bring it up, that I think we've all addressed it.
Yeah, and like I said, we kind of changed the rules a little, I kind of gave Karen the discretion, I said, I don't need approval
Right.
over there, just start allowing more as long as you're practicing social distancing. You're not unloading garbage right next to each other, and it is what it is. So, good question, though.
All right, so with that, we'll
Okay.
just move right in then to you're here for your budget.
Do you want a budget?
It is 20, 40, and 41.
So, with this, you guys are gonna remember that the numbers you're gonna see, you're not gonna have a very good description of what each one is. So you're gonna have to, I have my budget line, you were gonna, did you have a copy for me, you said?
Do, yeah. Here's 20.
Actually, I looked at it this morning and I got confused.
What's that?
I got confused when I looked at it this morning.
The one
Because you guys
that-
are categorized in the main 6 or 7 categories, where when I submit all my stuff, it's all per line items, individual.
sure, I
things.
know.
So if you need to know what this one is, I have to go to this and
I
I'll tell you what that
know,
was.
you remind us that every year. Okay.
So, let's see.
Well, I'm gonna ask you the same question I've asked everybody else. You use 2.5% for your increases?
So when I did this, I was supposed to have neck surgery,
Yes.
and with that, my budget has been done for 2 months, other than waiting, I was just waiting on the revenue portion.
Okay,
So, the union was already negotiated at the 2.5.
right.
When I figured my budget, I did 3s, just so that it covered no
You
matter
did
what
3.
happened. But, remember, my budget is fluid, so
Okay.
I'm not gonna go and change this stuff. If you guys
I
come
just
in, we
leave it
certify
out.
the wages, if you
Yeah.
decide it's 2.5s or 2s or
Yeah.
1, it is what it is, and then,
I just
Okay.
needed a number, so I
Yeah.
know, 3%. Okay.
and that was just for non-union.
Right.
So the union was already at 2.5, that was
I
figured out.
understand that.
Now, that being said, like I said, when we certify the wages, we have everybody's name listed, the foreman, my office staff, myself, and, well, not myself, mine's in the contract. And then we get, well, mine would be on that too. And then whatever is actual, what is certified on that, and then we give Gloria, and that's gets put in the computer.
Okay,
So whatever you guys
so
decide.
that
at
was the
point,
number
that's
you
what-
used. That's what I wanted to know.
So the first one, okay. So the first one is administration, that would be 1/3 myself, and my office manager, and my secretary, along with other office supplies, publications, computer services, schools, meals, lodging, and union negotiations. So I did budget the same as last year for the union, which was the 6,000, just because I know we'll be starting another union negotiation a year from now, basically,
Right.
for the fall,
For the
because
next
we're on the
fiscal year.
second year of a 2-year contract already. So there's nothing oddball there. The only one up previous year, I can't find your tools. So basically, my total went from 213,650 to 215,850.
So where do I see that?
Yeah, I'm not.
I mean, I'm, because I know it's so different than what.
So the 7,000 series, right? 215,
Yes.
850.
Yes, these go by the 7,000 series.
So you like, what's your total on
Okay.
these? Pretty much.
Is,
This shows,
But your wages are split between different.
yeah, it's different areas, but otherwise it's all the 7,000,
Right.
it's all salary, like Ivers.
So, yeah.
I'm just looking at that number, the last one down, 215, 372, whatever that is. That just said.
Oh, but this one doesn't put it out that way.
Okay.
It's not open, is it?
Okay, no, that's fine, that's fine. I was just curious. As long
Because
as
maybe
I'm
your
close.
all your 7,000 will be your number then, that's on here.
Okay.
Okay, I don't know if this is a good time to ask or not.
I mean, that'll be your, you want this to look at, or you
26,
got it?
443, 147, 167, and 20, 250. Okay, yeah, that 215 means nothing. Oh, that's the next one down, never mind.
Yep.
That's, gotcha. Sorry, go ahead and ask a question, sorry.
Janet? So, is she,
She's, Janet is looking at retiring sometime, and I'm not sure
but you don't know
exactly
when? So I just wondered when that plays into year two and kind of what your thoughts are.
Right now, my thinking is she's talking about maybe April, May, or June, I'm not sure,
Of this,
of this year. Yeah, she's not gonna go longer than into
okay,
next year. So at that time, my philosophy is that there's enough work to keep the office the way it is.
so replace.
Replace.
Okay. That's why I just wanted to hear what your thoughts were.
That's my initial,
Okay.
We can have that discussion.
as we move
Yeah,
forward, yes.
that's fine.
So that is all budgeted in here,
So
just like
that's
she
in
was
here,
on.
that's all I just
Yeah.
wanted to know if that.
At
is-
this point, it's not that if she's going or not, because I don't 100% say that she is, because I don't know that, but I think she is, but.
Okay, all right,
um,
all right. That's my question.
Okay.
On the first page of the one we have, Dustin.
Yep.
The one that's a big change is your engineering services, which is item 423, 7110.
Yeah, 423.
Yeah, it goes from two
Yeah,
million
2,777,000
to 1,000,009.
927.
So I'm just trying to figure out.
Oh, no, I didn't get that. Okay, so I gotta go to this page, let me go here, hold on.
I mean,
I mean,
changes
we're
is what I
fine with,
see.
it's a draw.
It's-
It's
isn't
a
that
draw.
nice?
I mean, I'm
Yeah,
okay
That
with
makes it look really
But
good.
then what aren't we doing, or what did we do
Okay.
this fiscal year?
So
we're
what
not
that
doing
falls under is our asphalt project that we did last year through Rudd and North.
Okay,
So that went from 1.1 million down to $200,000. So it's a $900,000 decrease. When I got to the end of my budget and put it all in the state thing, I was gonna try to do from the Avenue, Sulphur Road, down to the Rockford Road. As a
Right.
main, like we led the other way. But my carryover balance was gonna be 1.5, and if I did that, I would have barely enough money to carry over. So I said, I'm gonna have to wait a year on doing
Okay.
an asphalt project locally. That was the biggest thing there.
Okay,
okay.
That's why that decreased like that.
all right.
And next year you may see that bump back up, because if I build up that fund a
That's what
little
I
more,
wondered.
then I may throw another $1 million project in there like we did last year.
Okay.
Um,
So if you do that, do you have to amend your budget?
No, it would be, I would do the following fiscal year.
The following.
When I do a year from now budget,
Okay.
I
Got
would
it.
probably add that in. Like I said, when I went through everything, I got to it, then I'm like, hey, can I do $1 million project? Well, then it showed me about a $500,000 carry. I said, that's not enough for me to do business. I have to wait a year to do another local maintenance project. So, as far as the engineering portion of it, that would be the next 5 line item down, 07010. That would be 2/3 mine and me and Dwayne and Brian. Nothing crazy out there near there. I went from 439 to 442 as far as that goes. The next one would be day labor projects, which would be make sure you have it. Make sure I got the right numbers here.
Yeah, a lot of them haven't changed at all.
Yeah, that's what I was noticing.
Mhm.
Nothing that's really jumping out.
No, and the biggest thing might be 461, my rock budget, I went from, actually that didn't change much either, 1,405,000 to 1,453,000. So right now, I actually only have 2 day labor projects, but those are the 2 I'm talking about letting, and then I'll have a 3rd maintenance one, and then a 4th small maintenance one. But the biggest thing changed there would be that asphalt project, which I talked about. Seven. I'm just going down the list to make sure anything, it's very similar to this year. The thing would be the biggest thing is that asphalt project. Then plowing and chemical treatment, that stays the same. Material cost, salt tends to rise a little bit, that's probably the biggest cost there. And then a set of flows. Yeah, if you're analyzing from previous year, that's probably about the best thing. If you guys have a question, like you had a question on that one with the asphalt. Pavement markings, sign maintenance, that's all falls under 713. Nothing crazy there.
And then the other one that dropped, and as I go back in multiple years, it really dropped, but is 10-200, 10200. It's a 423 engineering services. See that one, Rusty? It's on the back side. Flip it over. Flip it over. It's 190,000. And at one point, you had up to over $1 million spent in that line item. I'm sure it's projects.
Oh, yeah, that one, that 1020 is the actual, that would have been Frankie's Bridge, like, those would be your major
That's why the
construction
big
projects.
one,
That's
okay.
state labors, and that would be if there's a locally funded project.
Okay.
Such as 195th Street out here,
Okay.
or 195th out
Right.
here a year
Okay.
ago,
Right.
would have been up there. Frankie's Bridge would have been, or it's called Frankie's Bridge, it's shown up by
I know what we're
Chuck, that would
talking
be the
about.
big one there.
Yeah.
So, yeah, those line items will vary depending if we have bridges that are on system or off system.
Okay.
This year, our bridge, which is let next Wednesday, is Farm Market Road. So this does not, that does not filter through this budget at all.
Okay.
Equipment, I have about the same dollar amount in there. This year, I had scheduled to get a tractor mower. But with the COVID and not unsure revenues and timing, I think I kind of pushed everything back a little bit by a year. So there's nothing different on there. I did budget accordingly to maybe either front end loader and or tractor mower, just depending on how things pan out here with revenues, make sure that everything falls in place. Equipment operations, which is your miscellaneous, your diesel, your fuel, oil, grease, tires, batteries. Basically went from 1,084,000 to 1,079,000. Same thing with the next line, which is tools and materials and supplies, guardrail signs, corrugated metal pipe, lumber, timber, nail welding supplies, went from 137 to 138. There's nothing over top. I kind of look back at the last 3 years and see where everything ended up and then where I adjust those accordingly. And then my overall went from 7,451,050 to 6,000,000, bless you, to 6,496,950. And I said, if you look at that, that's pretty much that paving project, that asphalt project. That's probably the difference there.
Yep.
Makes sense.
Okay.
So
All
nothing.
right, thank you. And then revenue?
Revenue, yes. So the revenues, basically the 500,000 is your local option sales tax. If you look at past history of that, that tends to be more than what I've always budgeted. I mean, I always be conservative on the revenues just for that fact, is be conservative, you want to say you're gonna get more than you actually get.
Right.
It might not be.
And you might.
And it might not, depending on how COVID goes, so I've always been nice to budget,
Right.
you know, like a
That's fine.
19,
It's gonna
20,
make a
it's
difference.
500,000, if I get more, then that helps my carryover once we get through the fiscal year. The road use tax, that's just given to us by the DOT, that's a spreadsheet generated by them that I just take and use the number that's generated for us by the estimation of the DOT.
It's been pretty steady, actually,
Yeah,
it
it
looks
has.
like.
So we'll see how that goes too, that might be down a little bit in the current year, and I'm not sure how that goes with COVID, but. Then the intercounty reimbursement is the 8,000, that's what Chickasaw pays, that's just a crapshoot too, depending on what is given, so, or what expenditures are. The transfer jurisdiction funds, that is the funding that's given by the towns under 500, the 39,492, that's an estimate too, that's
That's an
given,
estimate,
the
that's
same,
pretty
that's on the
consistent.
same page that I get for the road use tax.
Okay.
And then when I get those, I have line items, which was in the budget. I'll get that, turn around and give that as a payment out. Trips and permits are, that's a whatever. Sometimes it's more, sometimes it's less, and actually that one tends to be higher than my budget. Nothing crazy elsewhere. Second road material, 10,000. Miscellaneous, 12,000. So permits and, you know, we sell used pipe or we'll get, like I said, I'll buy culverts from people putting in driveways and then turn around and we charge them for the culverts at our price. And so that comes back as a revenue. And then the 125, 428 is the RSV, no, the GP, I mean. The portion that's 75% that is given as property taxes back.
So that's the 75%.
Yeah. And that's just based off evaluations that Corey gave me the evaluation worksheet. And then the same on the last one, 422, is that's the RSP portion, that's 75% of what the maximum levy could be. Sure. If you want to continue to give me
That's what I was just
75%,
thinking.
that's fine, or you can give more.
Or less.
No. No, I know, I joke that way every time. But, you know, in the long run, and going through all that with those revenues, you know, like I said, I take these numbers in and I put it into the DOT budget. And right now, that leaves me with a $1.5 million carryover. What I've learned over the 20 years, and that was when I first started, is that they want you to be somewhere between a third and a quarter, or a quarter and a third of what your expenditures are. So at $6.5 million expenditures, anywhere between 6 and 7. So even if you said 7, a quarter of that would be 101.75. So we're right where you're at. Because I don't start getting property taxes, well, until later, if even towards the end.
Property taxes? Well, our transfer we don't do till June.
Yeah.
The 1.5, is that pretty well meet or look like what you've done in past years?
Yeah, you know, once I finally got that, I will be giving you guys all the
Sure.
funds.
That's fine.
Yeah, that's fine.
I didn't,
Revenue thing, and
Right.
to me,
I thought maybe you had it right there.
Yeah.
I carry over. It's varied, I mean, because when I had the viaduct money in there, and
Right.
it was
Yes,
way
you
high,
had a
and so
lot.
we were spending that down, we did that project, and, you know,
I remember
over the
hearing
last
about
couple
it.
of years, it's been doing, you know, slowly going down on that carryover. You know, in 21, projections was 1 million, well, if I actually got to it, it's actually more than that.
But you ended up with more.
Because you get more revenues than what I
Sure.
budgeted, so that's kind of a misnomer, so. As long as we're staying between 1 and 2, that's all it's good.
Okay.
Okay, that sounds good. All right, we want to do 40, sanitary disposal?
Yeah.
And there's nothing crazy on that either, I kind of just,
And again, you use 3%.
yeah. I said that could be varied too, I mean, that's not right.
I just need a number,
No,
that's
just so we
what
know what you,
you use.
Yeah, so that's kind of a, oh, that's right. because even with that temporary help, I always had that low. And I started looking at that because of the subs that were taking place, and where we're at now, I had 1.8 budgeted for subs,
Yeah.
and we had paid out almost the 1.8 or $1,800 already. So I upped that a little bit,
Okay.
knowing that more than likely, a lot of it that was covered by whatever was in the regular salary for the Karen. So that's probably the big increase. General supplies seem to be lower, so I lowered that a little bit. Yeah, that's a hit. That's just looking at past history.
I mean, you're pretty close to what you were.
Yeah. Some years were higher. I think in 1819 is when we bought the new compactor. That's why that was a total high.
Yeah,
And that's working good, which is good.
right.
We're staying under what the budget actually had been in 20, and looks like we'll probably be under the budget what it was in 21 too. So. Okay.
Ginger, raise the rates.
I'm not 100% sure.
I was just curious. If Ginger would be raising the rates.
I know they did locally for me.
I mean, I'm not asking for what to
Yeah.
happen. Okay, and
Yeah, I
then
think
the revenues, then percentage of disposal? No.
I never had that sheet before, so I don't want to.
I think it's because it had revenue on there.
Yeah.
At one point there was,
Yeah.
back in 2000.
From the sold that.
When we sold the old one, that's why.
Yeah, that was why.
I was trying to figure out
That
why
was
that was
why.
there.
Well, is there anything else you could sell out there?
Yeah, exactly.
Okay.
Trash.
All right. Okay, 41, which is road.
That was road clearing, that's something you guys have put that money aside, and whether I charge for chemicals out of there, and then when we get to the end of the fiscal year, between my road clearing, which is brushing, mowing, and spraying, whatever is left in that after we bought chemicals and stuff out of there, you guys reimburse me for our work directly. And it's always been that 92,000 basically.
Yeah, it has.
I think at one time it was like 88,000 and
Yeah.
then it
And that's neither here nor there, that does help me with some offset revenues because it follows those categories and can be paid for with RSV, so.
That's why we can reduce his money then.
Yeah, you got that going on.
And other
That's
sources.
right.
That does help.
That's right.
Chickasaw was down at one time when I was over there, it was like 40,000 forever. Then they stopped giving me it for 8 years, and then I talked them back into giving it to me. And then that just helps that as a revenue for the offset for my department.
All
Yeah,
right.
guys, yeah.
You're too easy, Dusty.
Dusty, anything else?
I don't think so.
Okay.
Individually, I may talk to you guys individually outside the board meeting, just about different things.
Sure.
But I don't know about the conversation with Chickasaw County and my contract with you guys and all that. We'll see how everything pans out with all that.
Meeting's going well over there? Got different people.
It's different, and, you know, I like working with both boards. It just, sometimes politics gets in the way of trying to run the department. So that's,
Did they see 2 new supervisors or 3?
Yeah, they have 2, right?
basically, Rick
Well,
Holthouse,
Dave is no
beat
longer
up
there.
Dave Tokus. Rick was there before for
Right.
8
Right, yeah, I know.
think.
He was,
And then
but there's one.
Matt Kuhn came in,
Matt Kuhn.
and
That's what it was.
basically Steve Griff had gotten beat in the primaries by Ken Racing. And then Ken was running
Yeah,
against
Ken.
this Matt Kuhn.
Lost out.
Matt Kuhn won that one, so
So
he's new.
2
Yeah.
new
Well,
supervisors.
And then
Rick is
Jacob
already-
was up for re-election,
And
and
he
and so
was
then he was
received.
going against Joan Canola. And then Jacob ended up winning that, so he's back on it.
So he was received.
Yeah, and then Jason Byrne has been there, he's in the middle of his, and Tinsel's in the middle of his.
Okay. All right, well, thanks, Dusty.
Yeah, and the only other thing you had asked for in that, with revenues is major equipment purchases. Mine's a rolling, kind of hit or miss type thing. I have a list that I kind of follow, and we just see how good the equipment's holding up. If you guys want, you can have it, but it's, I do it. But that's up to you guys, if you want to see it, or you, like I said, each year when I go through the budget, here's what we're looking at getting, I can just, leave it that way.
I mean, that's
I mean,
Again, I'm not
it's-
here to, it's not about micromanagement. I think we just need to know the overall plan.
yeah. You know, like I've got 3 motor graders, or at least 2 of them, depending on, it all comes down to budget numbers when I get to those years.
Right.
So I'm talking about over 23 fiscal year now, 23, 3 tandem dump trucks again, or at least 2 depending how things pan out, either in 24 or 25. Front end loader in 22 or 23, 2 skid loaders in 23, 24, or 25. Track excavator, that's gonna be, I think that was an 06 or 07. That's gonna be 24, 25, 26, 27, just where the numbers
Sure.
fall in. Pickup trucks are evaluated on a regular basis when the ones that are out there get high mileage, now we kick them down the fleet. Durapatcher / nurse tank, that's one we share with the city, Charles City. It's almost at that point, I have my own employee, Chickasaw County, and it would be nice to have our own here. But we're gonna get this one, our last dollar out of it, because it's old. It's been around for quite a few years.
Did you purchase that with Chickasaw County in?
Chickasaw, Floyd, and Charles City,
Yeah.
and I bought,
Yeah,
I
I
had
thought so.
Floyd and City buy us out, and then I got my own in Chickasaw.
Okay.
So that's something to think about, 23, 24, 25, and then tractor mowers are in 22 and 23, so it depends. I have that,
I mean,
I'll keep it in my
you're
budget
maintaining that
folder.
list, so-
Yeah, so just so you guys are aware, I have it if you want to see.
Sure.
All right, sounds good.
Thank you.
All right,
Yeah,
thank
use
you.
pickups, it would be better than Dodge pickup by chance.
I think everything we kick down is, I
You're
mean, some of
still
those
looking.
outshed ones are so bad that they're almost, they go down to the state sale because they're rust buckets.
Yeah.
That's what John does.
Yeah. Thank you. If you get
Okay.
anything, you know how to get hold of me, okay?
All right, sounds good.
And you just have a copy of those 2 resolutions. Get them all signed, okay?
Yeah, before you leave, his resolutions have all the 3, well, 2 of you signed.
Okay.
Don't forget that one.
Sounds good. Thanks.
Thanks.
Rusty.
Guys, have a good day.
So, Todd, I see Bob was here, so
Yep.
we can do VA.
And I emailed Frank,
Do
but
you
I
need
haven't
a
heard
break?
anything
Do you
back.
guys want to? Who's all left? Do we need a break? Is what I'm.
I emailed Frank to see, he's the only one after PA.
Okay.
So I emailed him, and he signed up for 2:30 because of 1
But we
o'clock
do it,
meeting, so I
yeah,
didn't know what
right.
happened.
Yeah, we'll get it done, we'll get it done.
But I haven't heard back from him.
And it's 11, basically 11:30. Okay. Good morning.
I'm okay.
I can still say good morning.
Good morning.
It's been a long morning. Is Todd?
Todd's father-in-law passed away.
Oh.
Yes, so he will not be joining me.
So you'll be-
He's, funeral is,
Lost a lot, yeah. That's too bad. Thanks for letting
It's
us know.
exciting,
Hey,
I'll
Bob.
let you know.
Yeah, that is too bad.
yeah, he planned on being here, we, he and Gloria, and talk about this, so we were ready to do this.
That's fine. We appreciate you coming and
Yeah.
walking us through it, so,
Anyway, he will not be here,
So
until I get here, so.
yeah. So we have our sheets, so if you just
Okay.
want to kind of walk us through it.
How we're gonna try to run the office next year is how we tried to run it last year, before the pandemic.
Mhm.
With the use of funds towards acute ailments and things like that. Todd's salary is less than Maria's because the hair is long, and so you'll see a reduction in money, and that's basically up there now. Most of it's in the salary line,
What'd you put on for an increase for?
3%.
3%?
We're gonna do we're gonna do a 6-month jump right now.
That's
And
3%.
then we're going to do a 3%. We figured 3 and 3.
Oh, you're
Okay, we need to
splitting it.
redo this because we figured 3 and 2.5. Because 2.5 is what the board.
Okay, that's what we'll do.
Okay.
Okay,
That's
so
what
3
this
So
area
then
list
3
you
for
want to do.
6 months,
You're right.
and then at this budget year, 2.5.
2 and a
Because
half.
that's what
That's what's in there,
figures
yeah,
are.
yes.
Okay, that's it.
That's what's
okay.
in that date. yeah.
Okay.
Good.
Okay.
Yes, okay.
So, yeah, I wasn't including the 6 month in this, I was just.
No, I wasn't either.
Just,
Okay.
just
That's
what
good
it
to
was,
know.
That's why,
July 1.
that's why it goes up like it does, is
Yeah.
because we have a 6-month 3%, and then this is it.
Okay.
I told the other commissioner we're gonna do what the county does.
Well, we did, right, and what we did is we gave everybody direction to use 2.5% for your calculations. We didn't take a position that we were gonna give 2.5, we just said, we want you to give you a number for calculations. So, and that's where the 2.5, some of them have done something different, that's why I always ask.
Thank you, Roy. I clarified that, because those figures would have worked then if I was 33.
Yeah.
Oh,
I thought maybe your commission
No,
thought maybe there's
no,
more.
we met and reviewed that, and I just gave the 3 so 3 and 2.
Okay, sounds good.
So then bringing that down through, then that's the salary, and it was all that was reflected on some. By moving up to we thought we were gonna have to put some monies in because we were gonna be doing meetings upstairs, but we don't need anything. Our technology is going with us, and furniture is staying, and
Okay, yeah,
we'll move a little furniture, maybe that conference stuff will stay.
right, and we met with Todd about his furniture and knowing what he's gonna
Yeah.
get, yeah.
Yeah, so, yeah, it's
Okay.
pretty, yeah, it was gonna be that we replaced her, that's staying up there,
Right.
that's great.
Okay, sounds good.
So, once we get past the salary there at the top, and the equipment lines and stuff like that are very similar to what we've been going across. The one thing we can't control is death, and we think we put enough funeral costs in there, but you just never know.
That's always a gamble.
Yeah, just never know. So that could go up or down, but if it goes up or down a little bit, we can ask for a waiver on it if we're going to get a skew on our budget. But if we're still locked down, then we won't have to move any budget money in. We won't be able to spend it. So yeah, there's really nothing shocking here. So if you see something in it or standing out, let me know.
No, it's,
I saw the one that caught my eye was the mileage actually been reduced. You don't see, yeah, but I wonder what next year, because.
so
We're
remind me
thinking,
about the van.
oh, the van is not there.
Okay,
That the van is in a rental fee where we have a lease, and then.
okay, I was trying to remember where that ends up falling.
It's in that rental
Okay.
lease fee.
All
Is
right,
what the cost
You
of
don't own
that
that
is.
van.
yeah.
That will start cranking back up, that van.
That's what I see some of the schedules,
Yep, so we're going to
Monsters.
use the drivers that can drive.
Right,
Our problem with our driving corps, we have real good, a lot of them, they're all over 65.
Oh, yeah.
Not all, the majority of
majority of
them
them are over.
are between 65 and 75.
Yeah,
So that's a slot they don't want to put in the van. If they're comfortable going in, that's fine. And they've got safeguards set up so we can buy the stuff. But the travel line being reduced is thinking that we're going to stay on Zoom meetings and things like that, we're just not going to have a cost.
I noticed that, and you probably saw that on our ISAC upcoming supervisor, statewide supervisor. And then also the spring conference, they're showing in person.
Well, they are.
They are, and I didn't know whether you noticed that or not.
I hadn't
So then
seen
when
that
you
one.
start thinking about the affiliates, then we were all talking about that, whether or not we will be traveling or not this year.
Right.
I don't know. And they had the fall seminar too on there.
In the first year of being a director, they don't go out of state. very much.
Yeah, no,
And so
that's
any
fine.
traveling for training
would be
is
in
to.
state.
Zoom, so everything is
to Des
online.
Moines, and then the
Okay.
helpers are the regional helpers of the.
Right.
of the-
Because I remember who was it that helped Todd when he first
or
got here?
Marshalltown
Yeah.
and Story City,
Yeah.
it's where you can drive to
Okay,
and back.
that's fine.
With
Okay.
minimal
Because
cost.
this year is just not gonna be typical for us. Eventually, we will all go back to
Yep.
traveling to some meetings, although I think we're gonna see some meetings
I think they're gonna find out that they can actually function
Right.
with a phone meeting.
with some kind of
And in not
virtual.
all cases, but I do believe they're gonna find that out.
Todd will have to go to the fall meeting in the morning, because that's where he gets his recertification. That's a 3-day.
Sure.
It's a 3-day, and that's where the new commissioners, they go down for a day or two of that as well.
Okay.
Hopefully, there are no new commissioners.
Any soon.
But you never know how that works.
Yeah.
But so, but there are a couple of commissioners that like to go down to that. And so usually we have 1 or 2
I was
commissioners.
gonna say, I thought at least one
Yep.
had a.
Annually, we usually have 1 or 2 commissioners go down to it.
Yeah. You know, if it's good education on their part, you know, I think that's wonderful.
Yes.
I said, we've got commission members on some other groups that I wish they would, you know, take
Yeah.
advantage of some education.
And that's about the only education they give,
Mhm.
is that during that 3-day slot, whether it's to the commissioners or the directors.
Okay.
One,
Otherwise, I agree, I don't see any major,
Yeah.
one thing we did talk about is that eventually when we come out of here and the pace picks up again in the VA office, we may need some support, some secretarial, that kind of support. So we costed out what
I was gonna
we-
say, you've had that discussion
Yeah.
with Gloria, so she's
Yeah,
fully
we
aware
costed
of.
that out. We're not ready to go with it right now because we're doing appointment-only meetings with the vets. And the
Yeah.
band's not running every day.
Right.
And so workload for Todd, it isn't high yet. But when
And it
workload
changes.
increases, which we think it will, foot traffic increases, we anticipate being back where we were with the last 2 directors, where
Sure.
they just couldn't get the work done in
Yeah.
a 37.
well, and I've said this before,
We've
and
talked about
I
that.
really like to see, you know, it's really hard sometimes to hire somebody part-time to do something. So it's really nice if we can see, you know, you say, well, I can use this person 25% of the time, or whatever it
Share
might be, and then
within
share within departments.
We have talked about that, and that's what we want also.
Right.
So
Yeah,
we-
because
we
you
get
probably
someone
would
in,
need a full-time
And they would
person.
they would stay longer, they're
Yeah.
happier employees,
Yep.
Yeah.
all that
So
stuff.
we can figure something out.
Yeah.
And
So
maybe
that,
with the
that's on
new-
our radar.
So anyway,
And
yes.
we realize
That's on-
that, and I
this is-
appreciate you bringing
This is
it
on
up.
our wish list,
Yeah.
and we are willing to share with someone
Okay.
and adjust our budgets to reflect that.
Okay.
Right.
Sounds good. All right. And we'll figure out whatever that percentage is.
I don't know what that is either, but yeah.
But somewhere along the line,
Okay.
with, you know, and right now, there's more pressing things out there. As I hear the excavator moving behind us here.
Yeah, I was gonna say, we're in that mode right now. Yeah, things are moving within the courthouse itself, that
Yeah, there's,
maybe
We've got a
things
lot of
work.
things that we're just.
Yeah,
yeah, there's a lot of balls in the air right now, so whether we build a professional system for the pot or not, that's down there. But it's there in the future, if we can consolidate some things.
Okay, perfect. All right, anything else? If not, we appreciate you coming in.
Just
Thank
just
you.
another, I'll say this again,
Sure.
that Todd is doing a wonderful job.
I'm glad to
Good. He's
hear
been-
it, and
He
I,
has been, when we hired Maria, Bill and I were on veteran, we're the personnel committee. And when we hired Maria, we hired a person with a medical background in counseling. That's what we wanted. And that's what she was really good at. She was the vets come in. She
Right.
worked with them, she worked with the commissioners, she worked with the drivers. That's why, that was her strength.
yeah,
Todd's strength is management.
yeah.
He's really good in there, making those telephone calls, getting the paperwork done, getting to the lawyer's office and talking to, you know, that's his strength.
I'm really
And
glad
during
to
the
hear that.
pandemic, that's what we want.
Yeah.
So we actually hired somebody that's,
Yeah,
and the electrical file, all the files,
yeah.
within a month.
He
will probably
just
have the
came
whole
in
thing
with a
right there.
whole different
Oh.
way of, a different approach to functioning in that office.
Yes.
And I think that was one of the first things I noticed when he just dug in and says, we gotta scan this stuff. You know, I wanna be able to be home, you know, and be able to pull information up without having to be required to come into the office and go into a file.
We've been trying to figure
Oh
out
my
how,
gosh,
we've
thank
been
you.
trying to figure out how to do that for several years.
Yeah.
And it took pandemic to allow us to do
But
it.
he-
Thanks to Gloria though, too. She
Well-
sent some help down there, we had some volunteer help and that time, just
No,
having the
that's
strength to
wonderful.
do that stuff,
Right.
so.
Good deal.
Yeah,
Well,
he's a
thank
good-
you so
he's a-
much.
he's-
I'm
So
glad
far,
he's
he's been
working.
a real good
We
person.
haven't heard anything.
No, I
No.
have not heard anything, so.
We do have a revenue sheet, shows 10,000, actually $11,000 total.
Yep,
10,000.
that's a 10,000 grant.
Right.
And then
Yeah.
it's dropping because we're not hauling Chickasaw County veterans anymore. And that's why that's dropping. That was a revenue stream, so that's going down. But we still get donations, we're still getting them right now.
That's good.
Okay,
So,
good.
That's good.
and then we put that in there, but, yeah.
Wonderful. All right, well, thank you again
Thank
for
you.
coming. We
You bet.
appreciate that.
Keep the balls in the air, guys.
Oh, yes.
Stay safe.
Hey, right away, I don't miss it. So,
That's okay to say.
Retirement is great. All right.
Thank you.
Thanks, guys.
Thanks, Bob.
So we have one left. Treasurer.
Frank left, and he did respond. He said, I guess I could head this way.
I can't believe we're getting through all of these.
There's still a lot to go.
I was gonna say Gloria's got a bunch, I think, that we need to go through too.
We've done the easy ones.
Whether we do those today or not, we'll see.
So
No,
when?
I don't have any.
You
No,
know,
you're
I've
not
been too
ready.
busy with.
So
That's
when-
fine with
when-
me.
When are you estimating that you'll have those?
18th.
The 18th, okay.
So yeah, you'll have Board of Health, auditor,
Building.
We got-
the 10 courthouse budget.
We got claims to sign.
Yeah.
Let's do some of that.
And then if you have signatures too that you need of Roy,
Yeah, you just, whatever you need, sign.
here.
Get some of that out of the
I
way.
found a typo on that one resolution. I printed it upstairs, so I'm gonna run up and
So
get
you
that.
can run up and
Can we
get it?
just do a recess, 5-minute recess?
Yes, we'll do a recess. Go ahead.
Sure.
And I'll try to catch Frank up there.
That's just the chairperson signed this one, or it's got
They
three?
have- Yeah, underneath the
three.
chairperson, yeah.
Okay. Okay. Yeah, if I didn't know Doug wasn't coming, I should have sat up here. I apologize for that.
No, that's all right. We've
I didn't
now
know it.
social distance.
So it's his mom?
5-minute break.
5-minute recess.
He basically said that
So it's just.
we are back in, Stuart, we're gonna get you home for lunch.
Oh, good. My dog will be happy.
There's been many a day here recently, we just kind of blew through lunch. I get home at like, what, late in the afternoon, it's like, this is not healthy.